I would like to start my remarks by welcoming you to Istanbul, the apple of the Turkey say, to the regional meeting on the implementation of the Tuberculosis Action Plan for the WHO European Region 2023 to 2030 for the TB high priority countries. TB and drug-resistant TB remain an important public health threat in the WHO European region as well as over the world. The response of the COVID-19 pandemic has led to the distribution of TB services, like in other healthcare services. Countries in the urban region and at the global level have all had our share of the negative impacts. The WHO European Region 2023-2030 TB Action Plan, in the line with the European Programme of the Work 2020-2025 United Action for Better Health in Europe, provides key interventions area in the line with regions and TB strategy scores in reducing TB incidence, TB deaths, and increasing the success rate of treatment rifampicin-resistant and multi-drug-resistant TB patients. The most important feature of the action plan is that it combines the disease-specific approach with the health system approach, and it puts community at the center of the intervention. Turkey has a strong history in the field of fight TB, the fight which started at the end of the 1930s has been continued until today with a community and patient-centered approach. In the light of specific principles and evidence in diagnosis and treatment, with the support of all social assistance and the strengthening of political determination, to dramatically reducing the burden of the TB and ensuring efficient implementation of the services in the field. Turkey will continue to work on strengthening service in the three key pillars of the TB response. However, the humanitarian crises caused by war and conflict in the WHO European region are challenging. Turkey is at the center of human mobility, hosting Syrians and many other migrants and refugees from various countries. Turkey is providing comprehensive health and TB service to migrants in the form of screening and diagnosing and treatment services where they live. These services free of charge, similar to our own citizens. The humanitarian crisis that emerged in Ukraine at the beginning of this year has also shown that there is a need to increase solidarity and community between countries. We will be on support on implementation of the region action plan throughout the presentation of vulnerable and disadvantaged population with the principles of the ethics, human rights and equality, support with management and leadership, international solidarity, research and innovation promotion approach. I would like to welcome you and I wish you a successful meeting. Thank you very much.
Thank you. The next speaker is a representative of TB communities, Safarali Naimov.
Thank you. Good morning. Salam alaikum. Thank you again, Dr. Echo, for the invitation, for giving the floor to speak on behalf of people who experience TB these days. This is a big responsibility for me when, in these stages to speak up on behalf of those who are sick because of, it feels like you are not able to convey what is the reality that are there for people. And we have in our Tajik language a saying, Ohu boli bemoro, that's sort of in translation, sigh of pain of those who are sick will catch you. That's what always comes into mind. And we always working in partnership have this in mind. And in spite of the fact that we today, thanks God, thanks to all the available services, we exist and we partner with doctors, with honorable leadership in the country, in the region. But one thing that always, comes, that's my story, that's our family story. those days when you're alone, when you're isolated, when you're in a position that in spite of whatever service is available, why I used to read the pill boxes to see who are the producers of these boxes and whether can I contact them and who are behind those delivery, do they know whether how hard these pills are and do they know apart from these pills, there are so many other issues that, you don't find anyone to respond or to help you with. And that's what, even like by participation in this great event, actually, I was personally impressed with some of our neighboring countries, or even from my own country, the examples of best examples of the service deliveries that are like now closer to people. And those like it gives you confidence and it assures that like expanding those services and making it available for everyone would definitely help us, inshallah, to reach NTV. But we know that these are like small examples. I was in my time one of the family which was left behind the pilot areas that we have always been having. And so about our new plan, it's about like covering everyone and expanding and making the services available for everyone in our national programs. We were part of the development, and we know that like it's about like making sure it's for all the country and for everyone. That's hopeful, but we know that there are problems, sensitive issues in our countries everywhere. Those need special attentions and great leadership at country levels, and more depends on not only the doctors, but the whole society and the whole people in leadership in our countries. That's what, since this session is about commitment, it's about policies. So we are actually people who make these policies, or we make sure, or we commit to what we're saying, what we're signing. So in that case, that's simple. My message is simple. It's about, having UNHLM upcoming 23. We are very hopeful that this time we'll have attendance of our honorable presidents, honorable our respective and His Excellency leaders of nations that we are all proud of. And till then, I should mention also, we have our great doctors, our representation here, our deputy minister, whom we are friend, and there's something that, like at country level is very important for us. We're like directly contacted, and what his vision is all about, these pillars. Like he's our champion on preventive TB treatment. He's our champion on contact investigation, keeping all those key populations that we call rural areas, on those who are in need, in the center of our programming and projecting. So for any visions that he has, sometimes somewhat it feels like he knows of someone close, like who has seen TB, or it's definitely, we are witnessing people who are still suffering this disease. And just before coming here, a week before, we left a person who was like in pre-XDR stage, a lady who was like left for many years, inspired. Now we're at the latest stage, unfortunately. So it feels like whatever you're doing, you're doing nothing when you're seeing someone who are gone for this. So that's about like making sure that we don't see this death happening, and that's 90. That's all about, making it available for everyone. And after all, why we need the highest leadership in this fight is because just I remember 93, the year when WHO has announced emergency, global emergency, and so far we're yes, we have been like going up and we've been doing fine, but after all, when you're in a big trouble, imagine if your father suddenly appears or if your best friend appears to take your hand, like it's a moment when you feel like to cry and your tears come. That's exactly when we see our presidents show up with us. We know that their presence will have impact and will make lots of change because they're our leaders and the whole society follows like the word that is uttered by our leaders. So, and I must also thank all the doctors and especially the team, the excellent team that we are in the country. And we definitely will be together until the end of TV and will be witnessing. And of course, that's a responsibility, inshallah, will take up and achieve. Thank you again for giving the floor for these words. Thank you.
Thank you for bringing in these important perspectives of the TB communities. Next speaker is Nino Berzulli. She's Director Country Health Programs at WHO Youth Europe. Nino.
Thank you so much, and good morning, honorable deputy ministers, distinguished guests, dear colleagues. It is a great pleasure to be with you and welcome you all to this very important meeting that aims to set us towards implementing the new regional action plan for TB. First, I would like to thank our host, the Ministry of Health of Turkey. I would also like to thank our country delegations. It's so nice to see you all here, so many of you here physically in the room. Thanks that you made it. I know that some of our country delegations are also connecting online. Warm welcome to them as well. Thank you for your enthusiasm and rich discussions that you had over the last 2 days, as I was informed by my team from the regional office. I would like also to thank our partners, Stop TB Partnership, Global Fund, USAID for being with us and for their strong voice and the commitment to the TB agenda. Of course, our communities, affected communities. And Safar, thank you so much for being with us today and your truly great engagement at the regional committee in September this year, where the regional action plan was adopted. And of course, big thanks to my colleague from the headquarters, Global TB Director, Dr. Kaseva and her team. This is truly the three level of organization, headquarter, regional office, country offices, engagement and the joint event. So welcome all to this very important event. We all know that prior to COVID-19, the WHO European region had the fastest decline in TB incidence and mortality in the world. COVID-19 unfortunately changed this positive trajectory. But the fact that we all in the pan-European region live in so-called perma-crisis of pandemics, the war, new emerging diseases, as well as the climate emergency, requires us not to lose the sight of long-running crisis, which are often going unnoticed. And the TB, dear colleagues, actually is a long-running crisis. But despite this perma-crisis and despite this change of trajectory, I'm sure we can get back on track. The recent advances actually provides us unprecedented opportunity to end TB in the region. But for that, of course, we need to do more with less and to do faster than before. Achieving regional and global targets require reinforcing strategic shifts, requires bolder political commitments and the policy actions, as well as advancing sustained commitments. You will ask me whether or not this is possible. I'm sure with the hope and inspiration that comes from you and that and the countries that walk the talk, I'm sure that we will achieve these ambitious targets. And I've heard many positive examples, and I know that there are countries that truly walk the talk in towards ending the TB. So the response will need go beyond the technical areas within health and beyond health. This can be done by the governments prioritizing TB as an item for multi-sectoral action and prioritizing increased investment over the short term in order to reap the long-term effects and the benefits. This also requires engagement and partnership and stronger participation of the communities and civil societies more than before. Keeping communities in the center of response, as Safar said, it will be key. Mobilizing political support for a new TB agenda in the region, as well as additional financial resources, also will be paramount importance. This can be done by joining forces with our partners, Stop TB Partnership, Global Fund, and USAID. And again, thank you so much for your strong voice and commitment. We at WHO Europe stand ready and committed to accelerate our collaboration and joint initiatives with you. Dear colleagues, in today's complex world, the perma-crisis world, we don't know, we cannot know what health threats lie ahead of us, but what we are absolutely certain is that we must work together and we must work in the same direction, and we must work hard in order to regain upper hand in the fight against TB. And I'm sure that with such an enthusiasm and with such a great community of TB champions, we will be able to achieve this. Thank you so much.
Thank you. The next speaker is Teresa Kasaiva. She's the director of the Global TB Program in WHO headquarters in Geneva. Teresa.
Thank you very much, honorable colleagues and friends. It's a great opportunity today to be here with you again and share my message. Indeed, the world, as Nino highlighted, is very unpredictable, a lot of challenges, a lot of competing priorities, but we as a part of the TB community here to reaffirm our commitments and say that we are not competing, we are just doing what we must do. We are addressing one of the biggest global threats, and unfortunately TB remains one of the biggest global infectious disease killers. And the global situation is really sobering, grim. It also about situation with the TB epidemic, but in the same time, the meetings, the gathering like this, and our conversation over the past days and brings a lot of hope that with such a great community, I fully agree with Nino, we are able to overcome this crisis. And actually, it's not for the first time. A TB community, TB professionals are always working in extremely challenging circumstances, and it's possible. Ending TB is unfinished agenda. It's one of the sustainable development goals, and we have to do our best to achieve this goal. And my message is as simple as that people with tuberculosis, preventable and curable disease, should not die in the 21st century. We have strategies, we have tools, we are driving forward research and innovations agenda, and we have excellent partnerships. And I would like also to echo Nina and acknowledge all our national TB programs, partners, Global Fund, USAID, Stop TB Partnership, amazing civil society organizations, WHO across all three levels. You see that we are united, and it's possible really to dramatically change this devastating situation. And I would like also to use this opportunity to acknowledge leadership, unwavering leadership of the regional director, Dr. Hans Kluge, who himself is a passionate TB champion, and our Director General, Dr. Tedros, of course, as well. So no doubts that together we will end TB. Thank you.
Thank you, Teresa. We're now shifting to a virtual presentation by Lucica Diciu. She's the Executive Director of the Stop TB Partnership. And I'm looking at the back of the room to see whether this is going to work.
Can you see or hear me? Good morning.
Yes, Lucica, go ahead.
Thank you so much. Good morning. It's amazing, and I want to thank the team. First of all, the team that made this happen and make it work. Of course, we are more familiar with the online options these days, but it's very good as I'm able to be in time and also to not to take too much of your time in this opening. Thank you for the invitation. I know that the Stop TB Partnership team worked and will continue to work very well with the colleagues from the WHO European region. It's a long-standing relationship, and I'm very happy that we will continue on the same note. I've seen a lot of posts and photos, and I want to say hello to a lot of the friends from the region that are there in Istanbul. I know that you were a bit shaken yesterday morning, so I'm happy everybody's up and running, was already from yesterday. And I'm very pleased to see a lot of the friends that we have and we made over the years in this fight. I'm Lucica Diciu, I'm the Executive Director of the Stop TB Partnership. We have a good and impressive team on the ground from Stop TB there, and my colleague Viorel, who is there leading the team, to put it this way, and representing me and the partnership, can say, you know, how committed we were to ensure that we have 5-6 colleagues there with you. Now, this is not about who is there with you. This is not about Stop TB Partnership. This is about TB. I have 3 things to say. One is, it's the year 2023 almost. 2022 was a horrible year for many reasons, for our region, I think in the world, but for our region, and for some of us particularly, a very, very, very ugly year. Ugly in the terms that it brought in front of us challenges that we didn't expect. I'm referring to the war in Ukraine. I'm referring to the climate change and the aspects in different countries. And I'm referring to the overall situation with TB that my colleagues that spoke before referred to. We got pushed back, and TB continuously struggled to remain a priority, or to be a priority in some countries. We have the tools now. They are not perfect, but we have very good tools to be able to end TB, and more is coming. The pipeline for diagnostics is huge. We have capacity to have mobile diagnostics, X-ray mobile diagnostics, and portable, shorter treatment regimen for normal TB as well, for drug resistance. We are advancing on preventive treatment. We sophisticated the way in which we have the data, and we are able to model and see what can end TB. And we have the knowledge. In addition to this, or on top of this, as an important thing, we have a lot of TB survivors and civil society and communities engaged in this fight. And I think slowly, the mentality of engagement of those affected by TB that should be at the core of our interventions is actually having a huge impact here. In addition to this, we have the guidelines that are available to recommend the best way to deal, that our colleagues from WHO developed and put in place. And in this region, let's admit it, in this region, we have a solid or better than in other places, health systems and primary health care. We have all of this. Nothing that I said here, you can say, well, this is not, this is that. So why are we where we are? We are there for 2 reasons. First of all is that we still don't have the understanding and the ear of the decision makers, And I'm going here above the ministers of health. I'm going here to the ministers of finance, to the prime ministers, and even the presidents of the countries to understand that this airborne disease that is curable, that is preventable, that is very cost efficient to treat, is not yet ended, and it's a threat for everyone that breathes. Okay, we don't have the year of them, and for whatever reason, we were not too much unleashed. We were not too much upset, and we continued our hard work every day. As Teresa said, the TB people work a lot in a lot of difficult situations, and we continued like that. Some money there, some money there. One of the many things to be finished. And TB is not one of the many things to be finished because it's spread, it's airborne, it's a snowballing effect. It's every single thing that is done wrong is translated into a drug-resistant TB, MDR TB, XDR TB. It's transmitted in cases in children. We've seen now after COVID cases in children that, at least me, I read in books. I've seen something from 2 countries coming from the region, some cases of TB in children, very, very serious with cavities and so on. So we don't have the ear of these people. Are we able to have them listen to us? We will try and we will continue to push, but this is not the effort of one or another, it's a collective effort. The second thing is, I think we need to embrace very much civil society and communities, strengthen them even further. Only people that are affected and suffered, Safar spoke very well here, will be able, including with the ones that take care of them, in an amazing partnership, and I would say almost like in a, sorry for the comparison, marriage, will be able to make a strong case in front of the decision makers, will be able to be outraged for the lack of access for some people, for the increased price in some parts of the region, for the fact that we are still having people diagnosed with microscopy without using the current recommended tools and guides and so on. That are still treated with long-term regimens that are still not followed up and so on. We have the UN high-level meeting. There is a session today afternoon. I'll join as well. We have in 2023. It's up to us to really push our governments to engage, but also to participate in the meeting and to have a very strong political declaration. Without that, I think we will still float somewhere among the many diseases that are on the agenda of people. And that's why the attention to TB, because it's not a funny disease, because it's not a disease that affects people that are in the face of media and the attention. Without that, I think, my friends, we will still meet in 2025, in 2027, in 2030, those that will still be in these positions and so on. It's morning. I'm sorry that I had a bit sour intervention. This region should be the lead and should be the one ending TB before all the other region. Not eradicating, not eliminating, but ending TB by 2030 is possible in the world, but it's possible very much in this region. And I'm looking at everyone here in the room. I'm very happy and honored you gave me this time. Thank you very much.
Thank you,
And now-
Lucinka, and especially for saying that it's this region that can end TB. Next speaker is from the Global Fund. It's Dimitri Latishevsky. Sorry if I didn't pronounce it correctly, but please, you have the floor.
Thank you. Honorable panel, dear colleagues, the Global Fund is a committed partner. Our current investment in TB and HIV in the region is over 600 million, and we are committed to continue to invest to end TB. We understand investment in the classic sense. It's spending $1 to get more than $1 in benefits. So in that, we will, of course, invest in the most efficient interventions and in the most up-to-date, evidence-based interventions managed by the most efficient managers. In that, we will be with you until we end TB in 2030. Thank you for your attention.
Thank you. And then we go to Sevim Ahmedov from USAID.
Thank you very much. Let me just start by saying good morning, first of all, and then express my sincere appreciation and gratitude to our gracious hosts, the Ministry of Health of Turkey, again for hosting us all this week, and also to my colleagues from WHO for convening this meeting. So in terms of USAID, again, we work in all the countries that are present here today, and our commitment to continue to support the fight against TB is relentless. So this is an important meeting for us. We had really good deliberations and discussions in the last 3 days. Really focusing more on the technical part of what needs to be done for us to advance the technical agenda on further reductions in TB incidence and mortality. What we would like, and similar to what Luchika said, we do have the tools, we do have the ambition, we do know how to deal and how to fight TB. I mean, we have enormous expertise in this room, enormous knowledge from the technical side of things, how to deal with tuberculosis. But what we want to focus on today is really on the political commitment. In my native country of Bulgaria, we have a saying, it's one thing to know how to do things, it's another thing to want to do it, and it's actually third and fourth things is to actually do it. And that's really the critical part. Can we actually do the things that we know how to do and we want to do? And that's where the political commitment comes, and that's where that political commitment is very important. And what does political commitment mean? It's usually expressed in terms of dollars and euros and other currencies. And when we try to measure that political commitment in terms of the resources that are allocated to TB, that's where we're seriously failing. The Stop TB, the global action plan to end TB, which Stop TB recently issued, estimated that the gap that we're facing globally to end TB by 2035 is about $250 billion. $250 billion. We're facing the huge deficiencies in resources. The UN high-level meeting in 2018 was really a great event to mobilize and energize the global TB community and really highlight the importance and the urgency for us to address this ancient airborne disease. And yes, we did have very ambitious targets. And yes, when we take stock of those targets, we are a little disappointed saying, well, we did not achieve the targets. But I don't think we should be, it's completely a negative story here, because if we look at the amount of funding that we had and how the level, we still moved the targets a little bit, but that happened in the context of a devastating COVID epidemic, right? So from that perspective, I have to say, trying to see the positive, we actually, again, we did a lot with very little. And we're very excited to have another UN high-level meeting coming up in September or October next year. And I agree, we need to have a strong voice. We need to have strong political commitment and expression that the current situation is no longer acceptable, and we do need to accelerate the fight against TB. So, talking about the targets, one target was achieved, right? The people living with HIV that were put on TB preventive treatment, we actually exceeded that target. And why? Why did we manage to do that specific target? The answer is very, very simple. I mean, if we have the resources that the HIV programs have and they put in, we can do that. We can easily, for me, that's the lesson learned why this specific target we managed to get to it. Similarly with TB, it's if we have sufficient resources, we will be able to get there. And again, I totally agree. TB will require whole society approach. It will require ministries of health, the political commitment policies that we all have. It will require community engagement and really making sure that people who know and suffer from TB are also engaged in this. It will require people like, working for USAID and Stop TB, WHO, all the rest of the partners for us to be able to bridge and translate policies into practice, and of course the countries and the national leadership of these programs. And lastly, just to say, today in the US, most of you probably know, there's a big holiday in the US. It's called Thanksgiving holiday. So usually what happens is people gather, families gather together around the table. We have a big meal. Usually we eat a turkey, not the country, but the bird. And then we express thanks. So allow me today to just say, what I am thankful for today. One, I'm all thankful to you and for coming on a daily basis to do this work. So thank you very much to everyone in the room for your effort and daily relentless effort to fight TB. But also, I'm very thankful to the Ministries of Finance. I'm very thankful to the US Congress, and these are people who are providing the funding for us to be able to continue to fight TB. The majority of the funding for TB comes from domestic resources. That's why I cannot emphasize more how important it is for us to have also the support of the Ministries of Finance as well as the Ministries of Health. So with that, again, I look forward to having another productive day and wish us all good results at the end of the day. Thank you.
Thank you, Sevim. Our final speaker is Paul Sommerfeld. He's the chair of the Regional Coordinating Committee. So Paul, the floor is yours.
Thank you, Chair. Thank you to all my friends and colleagues here in the room and those involved in this meeting online. My particular friend, Safa Naimov, in his remarks this morning, mentioned the meeting of 1993, almost 30 years ago, which was a WHO gathering at which we said that TB is a global emergency. Now, I'm ancient enough that I was present at that meeting. And I have to say that there are some things which have not changed. We continue to feel, all of us in the TB world, under-recognized, and that tuberculosis is not taken seriously enough. So many of the things that Luchika has been saying this morning and on other occasions were as true 30 years ago and sadly are as true today. But on the other hand, some very good things have changed. The voice of people directly affected by tuberculosis is much more recognized within the work against tuberculosis. The potential role of those of us in civil society is better recognized. And in the last couple of years, finally, new technological tools have begun to arrive. And so today we are actually in a period, I think, of great excitement in tuberculosis. We're now working on a disease where we realistically and truly can believe that this disease will and can be brought down to the level of a very rare event within the next decade by our target of 2030. Those of us in TB Europe Coalition, therefore, were we welcome the positive targets and indicators for community engagement that are incorporated in the Regional Action Plan, which is the topic of our meeting here today. We believe that that plan recognizes that community and civil society are in a position, can be used more than we already are. We could do a great deal more to help national TB programs achieve the TB care and the targets, and generally accelerate our progress towards the end of tuberculosis as a significant disease. Now, I know many of you think that civil society is a bit of a nuisance at times. We can be a troublesome bunch. But on the other hand, remember, first of all, our traditional area of activity is advocacy. I'm sat next to my colleague from Global Fund. Well, the fact that the Global Fund replenishment budgets that have just been announced at their board meeting last week, that replenishment is even a little bit above what has been the current period's funding of the Global Fund. We are, of course, disappointed that it is less than we had been banking on and looking forward to, but nonetheless, it is more than the current funding period. And that is by no means accidental. It is in good part due, among others, to the advocacy of civil society organizations across the donor nations. So remember, when you are being a little bit critical about civil society, we actually do something to make sure that there is more in your budgets. But the other area which I think is important and that we focus on here rather more is the role of civil society in the delivery of services. And here is the area where I believe that although we are doing more than we were, that there is more civil society, particularly at local level, than there once was. We still need to be nurtured. A couple of days ago, I raised the issue of TB preventive therapy and the fact that we tend automatically to think medically about what that means, but have a blind spot then to seeing what can we do to actually draw in civil society who are much better culturally attuned than medical services to building community awareness and to supporting individuals under treatment during many months of treatment when they're actually not feeling unwell and wonder why they're taking these pills. Those are the sort of jobs that civil society can well do. But for us to do them, we need to be nurtured. And that's partly funding, of course, but it's also being taken seriously, being drawn in. And here I would pay respects to Askar Yedelbayev and his colleagues in TB Europe, WHO Europe, who have done much in the recent years to make sure that we are taken seriously. And so I'm looking forward today to the development of action recommendations and to recommendations that will also come from the technical advisory group tomorrow. And I look forward to us all working together to find more partnership and collaborative ways to accelerate our work against tuberculosis and achieve the targets of elimination which we have set ourselves. Thank you.
Thanks, Paul. For those people here who do not have a talk afterwards, I can go to another place if you feel more comfortable there. And then I have two announcements. The first one is that participants departing today would need to check out before 12. So either you've already done so or you can do so in the coffee break. And if you need transfer to the airport, please contact the transfer desk. That's also in the lobby. The next on the program is a video, and it's a story by an XDR-TB survivor. And I see that it's now being put on. Yeah. next speaker is Nina Rezzuli. She already welcomed you, but now she will have a speech on renewed commitment on the way forward in ending TB in the region, New TB RAP 2030.
All right. Do you hear me well? Do you hear me? Okay, very good. Thank you. So, can I please ask to put the presentation? Yeah, thank you so much. So the brief talk that I have this morning is on the commitment on the way forward in ending TB in the region and the strategic and operational shift that we envision through our new European TB Regional Action Plan. And I'm sure during the last 2 days you've heard a lot about the situation with regard to the TB in the WHO European region, but I still would like to give a spotlight on the situation of TB in the region. As you can see, TB, especially the drug-resistant TB and TB-HIV co-infection, continue to pose the major public health challenge and the burden in the WHO European region. The proportion of drug-resistant TB cases detected among new and previously treated TB cases significantly exceed the global average. In 2020, the WHO European region was the home to almost quarter of the global burden of MDR TB and 47% of the global burden of the pre-XDR TB. An estimated of 29,000 people have TB HIV co-infection. Of course, despite this challenge, we cannot ignore the fact that there has been significant progress and the successes in the fight against TB. As I already said, the WHO European region prior to COVID-19 had the fastest decline in incidence and mortality from the TB. And these successes were due to political commitment, financial commitment, and many innovations and the tools that have become available recently, as already was mentioned by Luchika in her opening remarks, as well as by my fellow panelists. Whether it is the improved access to the WHO recommended rapid molecular diagnostics, the new fully oral treatment regimens, new service delivery modalities, and the models of care, all this contributed significantly to achievements that we see so far. But despite this progress, we still have the challenges. And as you see on this slide, treatment success rate have remained stalled at 56%, well below the target of 75%. TB-HIV co-infection is on the rise in the region, with estimated infection rate of 12% among incident TB cases in 2020. And for the TB preventive treatment, the progress made during 2018-20 fell short of the 2 million people receiving the preventive treatment, reaching only 16%. And the barriers to uptake of the preventive treatment is, of course, concerns regarding the risk of toxicity and generating the drug resistance, as well as the availability and the access to the preventive treatment regimen components. So I already said that the COVID-19 pandemic has reversed the years of the global progress in tackling TB, with reduced both rates of the TB notification as well as the number of people who are being enrolled into treatment, especially with MDR TB. And we are off track, second year in a row. The just released global report on TB in 2020 proves a grim reality check. An increase in TB mortality in the region in 2021 compared to 2020, and stalled incidence reduction curve first in the last past 20 years. So now we need to address the challenges which were those unresolved issues before the COVID-19 and new challenges simultaneously. And there are chronic issues that we need to address. First is the health and the structural factors that increase exposure and vulnerability to TB that are affecting the pace of the progress, including some of the important risk factors and the determinants such as smoking, alcohol, and substance use, as well as the diabetes and other non-communicable diseases, as well as important TB determinants, the poverty, undernutrition, unemployment, and imprisonment and migration. We must close the gap addressing the comorbidities and the co-infections. And of course, this requires the coordinated response across all health services and beyond the health sector. Health systems level challenges and inefficiencies that limit the resources that are available for the high impact interventions. And here I would like to mention the continuing high rates of hospital admissions that are not clinically indicated and extended stays in the settings with potentially poor administrative and poor infection control measures. And this requires bold political decisions in accelerated transition to people-centered models of care. Slow uptake of innovations. We've heard that there are many innovations, many new tools and the instruments that are available, but there is still incomplete transition, for example, to fully oral treatment regimens for TB and particularly for the drug-resistant TB and the people-centered care models. Targeted screening in key and the vulnerable populations outside of the health facilities is still not a routine practice. Smear microscopy still not replaced by the rapid molecular diagnostics. This, of course, requires increased investment and reallocation of scarce financial resources for the high-impact interventions and technologies, as well as ensuring access to the quality diagnostics and transformations in how services are organized and delivered. Barriers to care still also issue. People affected by TB still face challenges with accessing to care, including financial barriers prior to being diagnosed. And we need to maximize the use of service platforms and set robust patient platforms, more community-based and more primary care-based social services, public health services, to address comprehensively all needs of our TB patients. And the challenges that we are facing in the multiple crisis situations or the perma-crisis that I already mentioned during my opening remarks. Yet, despite these challenges that we are facing today, we are living in very exciting time for TB. New technologies such as new diagnostics, fully oral medicines, the treatment for drug-resistant TB, digital health solutions. And Teresa was just sharing with me the global app for TB that provides the very important resources for the TB available, a report and all the technologies and the new guidance that are there. So I encourage you all to download, this app. Digital innovations and the innovations in the service delivery platforms that we have in our hands, but they require increased uptake. So, of course, we have, it's been very re-energizing, the commitment for the TB and adoption of the new TB Regional Action Plan at the Regional Committee this year in September in Tel Aviv. We have great tool, great instrument, action plan in our hands. It's a matter of implementation. I would like this regional action plan, first of all, was developed through the very robust consultative process, engaging the member states, engaging the partners, the affected communities. And I would like to thank all of you for your engagement, commitment, and support endorsing the new TB Regional Action Plan. So the Regional Action Plan, as you probably heard from my colleagues 2 days ago in the opening of this very important event, has very ambitious targets. And these targets are set, reducing the TB incidence by 80% by 2030 and reducing the TB deaths by 90% by 2030. These targets are aligned with the global anti-TB strategy. In addition, we have the European program of work, where the TB is the key area and the key pillar. And there is the midterm target, the milestone that we need to achieve by 2025. So can this be done? Given the current challenging situation and the pace of progress that we have so far. The epidemic modeling exercise that we conducted when developing the TB Regional Action Plan provides strong ground. Rapid uptake of innovations, including an expected vaccine, which will be truly a game changer, will cardinally change the landscape and prospect of ending the TB in the region. If we use fully the package of available tools and the innovations, sequentially putting this into place, it is possible to regain the path of incidence reduction towards elimination targets. If we scale up preventive treatment of TB, the incidence target, as you can see on this slide, could be reached by 2034. And if an effective TB vaccine becomes available and the TB vaccination uptake will be high, then starting in 2027, then we can achieve the incidence target by 2029. So the TB action plan that was endorsed this September has 3 core pillars, and these pillars are aligned with the end TB strategy. The pillar 1, which is the integrated people-centered care and prevention. Pillar 2, bold policies and supportive systems. And the pillar 3, intensified research and innovation. But the regional TB action plan has renewed granular priorities that are region-specific and the context-specific, given the involvement of the regional context since 2015 and a robust SWOT analysis that was done before putting together this regional action plan. It places more emphasis on people at the center and the importance of removing barriers and more support, the importance of health systems approach in improving TB response, governance and multi-sectoral action, health finance and the universal health coverage, access to medicines and diagnostics, and intensified operational research support as a vehicle for rapid uptake of innovations. There are several strategic and operational shifts in the TB regional action plans that I would like to point out on what needs to be done to collectively and how to reach the targets by 2030. First is the renewed political commitment and bring TB back to the spotlight. The priorities are to set up the ambitious policies and resources for TB and improve accountability and multi-sectoral action. Second is alignment with UHC and the PHC, putting people at the center of the response and leaving no one behind, in line with the global program of work and the European program of work of WHO. And priorities here are to ensure the complete transition to the people-centered services, expanding delivery in primary and community settings through essential clinical and supportive service packages, prioritize key and vulnerable populations and promote the right-based TB response and equity in access to quality prevention, the early diagnosis, treatment, and the care. And of course, engaging the civil society organizations and communities affected in TB response. Third is recalibrate the core diseases function, reducing incidence, finding early and treating fully. And here the Regional Action Plan proposes shift to targeted screening for TB disease and scale up of TB preventive treatment, ensuring universal access to rapid diagnosis for TB and comorbidities, reducing hospitalization by complete transitioning to people-centered model of care and to fully oral treatment regimens for TB and the drug-resistant TB. Fourth is to take advantage of technological advances, innovations, and promising pipelines. And here we're focusing on accelerated deployment of new screening and diagnostic tools, medicines, vaccine, service innovations, and digital health solutions, and acceleration of the real-time data systems. Fifth, it's the overcome impact of emergencies and the crisis to regain the losses due to the multiple crises, ensuring the universal access for TB prevention, early diagnosis, and care. Get back on track through full recovery of funding of national TB response, mainstreaming TB response innovations in the COVID-19 preparedness, COVID-19 response plans, and ensure that the TB response is fully integrated into the pandemic prevention, preparedness, and response plans. Plan for TB contingency and resilience to future crises. How we're going to deliver this? The Regional TB Action Plan strives for a better balance of support at the regional, sub-regional, at the country level for a greater impact at the population level. This can be done by putting an effective actions on main technical areas that serve as the presence and using new entry points through primary care partnerships and stronger country presence, and using new entry points and improved access to products that are available. And of course, through the European Program of Work flagships initiatives, which are particularly relevant for TB response. This is the Pan-European Mental Health Coalition, ensuring the mental health services and the psychological support. And I would like to also note that today, the second regional conference of the Pan-European Mental Health Coalition kicked off in Ankara, Turkey. So we have in Istanbul the TB Regional Action Plan meeting, and in Ankara there is the Pan-European Mental Health Coalition second regional meeting. So Turkey is hosting two very, very important events. Empowerment through the digital health solution, which is another flagship initiative of the WHO Europe, as well as the healthier behaviors, incorporating behavioral and the cultural insights into the TB response and in the provision of TB services. Now, to increase commitment and to attest the political commitment prior to the adoption of the TB Regional Action Plan and prior to the UN high-level meeting on TB in 2023, we convened a ministerial session at the Regional Committee 72 in September in Israel to reset the course towards ending TB and AIDS and eliminating the epidemics of viral hepatitis and sexually transmitted diseases. And during this session, the member states talked about the progress they had in their countries with regard to the TB response, HIV, AIDS, and hepatitis and STI response, and share their perspectives, how this needs to be taken forward. Partners that attended this session provided an overview of how they can support the government to get back on track towards reaching the targets. This session ended with tangible commitments ahead of sub-regional ministerial meeting in 2023 that we are planning, as well as the UN high-level meeting next year. So your ministers and the heads of the delegations at the regional committee committed to these key areas. First is convening relevant stakeholders to review the progress towards our goals to end the diseases and resetting immediate priorities for 2023, protecting current funding and proposing an increase in public funding allocations for TB, HIV, and viral hepatitis STI programs and services, prioritizing services for key populations and those who are at increased risk of TB, HIV, and viral hepatitis, leading preparations for 2023 UN high-level meeting through multi-sectoral consultation and mobilizing attendance of the highest political level at the meeting, and planning to attend the meeting in person and reporting on progress at the sub-regional meeting on HIV, viral hepatitis, and STI we plan next year. So the commitments were very serious, and this is also good to know and reflect on. And one other very important achievement and the sub-regional platform that was launched during the regional committee in September, that was the Central Asia Regional Roadmap on Health and Well-being that was also signed by 5 ministers from Central Asia, committing to this roadmap, ensuring the TB, HIV, and hepatitis is a key pillar in this roadmap. And the key strategic results that are in this roadmap relevant for TB is the enhancing the political leadership and commitment, increasing the WHO multi-sectoral accountability or strengthening the WHO multi-sectoral accountability framework for TB, improving the targeted active case funding for TB and scale up TB preventive treatment, institutionalize the operational research on shorter, more effective and potential safer treatments, regularly review comprehensive TB, HIV, viral hepatitis and STI national programs, and applying behavioral and the cultural insights when developing the national TB response programs. So I know that I exhausted almost all my time, but this is my final slide. I call on us not to be modest in our implementation plans. We know that the financial resources matter if we want to succeed, and using our new regional action plan, newly endorsed European Regional Action Plan on TB, I call on you to revisit your priorities and the funding allocation, invest both financially and in human resources in this fight. Innovation is key, and we've heard that there are a number of very important tools and the instruments that are already available, but we need to use them more effectively and scale up their use, including also innovating on the new models of care and the new service delivery platforms. And finally, what matters most, dear colleagues, is our mindset, focus and determination. And I'm sure that, with this in mind, we are going to win this fight. Thank you.
I see someone with something.
Actually, I want to have, I need 1 second to make one announcement. Colleagues from the regional office told me that we have We have birthday girl, woman in this room. It's Yulia Galancha, who has a birthday today. She's our PAG member. So congratulations and happy birthday. Happy birthday.
Thank you. Thank you. Dear audience, I'm fully aware that we all are already at the time of the coffee break, but we still have one very important speaker to come. So I'll give the floor to Teresa.
Yes, we can vote. So if you would like, if you prefer coffee, I will be fine.
Please take the floor. And I hope that the organizers find a solution so that you can still have your coffee break.
Well, thank you very much, dear colleagues. Indeed, sorry for taking your coffee break time, but I have some good news also that it's my last intervention for this meeting. So hope I will try to be brief, concrete, and share some important messages with your permission. And Nino actually made my task easier, covered a lot of important aspects, but in the same time, you will be able to see our alignment, across all the organization. Few words about our global TB situation. You can compare how European region is positioned and look like in the perspectives of the global commitments and progress towards ending TB. As I've told, indeed, situation is, let's be frank, grim and sobering, and data clearly shows it. We are collecting data on the global TB epidemic since 1995, but as Nino highlighted, we are now trying to be aligned with the new technologies. Over the past 3 years, we're developing digital version of our global TB report. Please download it and use all the information, because information is power and makes our response stronger. Of course, what are the top news from the global report? They are clear and extremely concerning. For the first time over the past 2 decades, number of TB incidents increased. 10.6 million people fell ill with the TB, and what is more concerning, only around 4.2 million people are so-called missing people. And it means that they didn't have access to essential life-saving services. This is a picture that runs since 2015, and you can easily see that the recovery is not yet at the levels of the pre-COVID. With the gaps is significant, and what is more concerning, it is increasing. If you look at how we've managed to decline TB incident since the year 2000, it's again obvious the decline was very slow, only around 2% per year, and we've managed to decline only by 10% and didn't reach globally our anti-TB strategy milestone for 2020. If we look to the picture in the different regions, you can see that only European and African regions, 2 regions who reached this 2020 milestone for TB incidents. And what is more maybe important, this side of COVID impact, European region managed to keep this trend. For your information, updated list of high TB burden countries. We've updated it last year. We are doing it every 5 years. And you can see in red, so-called group of countries with high TB burden, in yellow TB HIV, and blue MDR TB burden countries. We have 30 countries in each of these lists, and 49 countries at least in one list. And again, you can easily find that the most of the countries in the list of high burden countries with MDR-TB are from European region. 9 countries, and also we see that in other categories, in category of high TB HIV burden countries, your region is also represented by Russian Federation. We're using new approach, so-called global TB watch list, where we are putting countries just transition from the high TB burden countries list. And we have 3 countries in the global watch list since 2020, Cambodia, Zimbabwe, and Russian Federation. It means that we cannot celebrate and declare that now they are moving towards TB ending or elimination. It means that more precise attention will be needed to understand what will happen. Either they will return back to the high burden country list, or they will continue the positive trends. It means that they've been replaced by 3 other countries who joined the list: Gabon, Uganda, and Mongolia. But also for your region especially, it's important to remind that we have also other categories of countries and further targets. We have so-called low burden countries with less than 100 cases per million, low incidence country. We have a pre-elimination group of countries when the burden is less than 10 cases per million, and elimination countries with when the burden is less than 1 per 1 million population. So that is the difference between ending and elimination of TB, Luchika mentioned before, and we have to move, of course, to this goal by 2050 as highlighted in the NTB strategy. If you look at the category of low incidence countries, there are 57 moving towards pre-elimination. The vast majority are again from European region, and it means that many countries in your region have very good chances to be champions in movement towards TB elimination. So trying to move next, but it doesn't work. Okay, it works. Now another important indicator, TB death. TB apparently is becoming again #1 infectious killer once we are overcoming successfully COVID-19 crisis with 1.6 million deaths, and it's significant increase. For the first time, death increased last year, and this trend continued. It was predicted, and we are predicting, unfortunately, further increase in 2023 and 4 if services and access to services will not be urgently restored. Trends in TB incidence look more or less similar, with the slow decline since the year of 2000, and overall we reached less than 6% decline. According to, in compare with our NTB strategy milestones, it's only 1/6 of this milestone. Of course, impact of COVID-19 is obvious, but it's not the reason to give up. What is more concerning, again, especially for your region, trends in the drug-resistant TB burden. We are observing increase in the drug-resistant TB incidence as well. It's for the first time, situation was more or less stable for many, many years, and again, it's due to the impact and drops in TB notification and access to the services. And you see this negative cascade that only 1 in 3 persons with the drug-resistant TB has access to treatment, and treatment success rate is not higher than 60%. You can easily compare that, unfortunately, in your region, it's even lower treatment success rate. It's about 57%. And to summarize the progress towards our NTB strategy milestones, we are off track, and now we have another more ambitious milestone for 2025, which is fully aligned with the regional action plan. Again, it's not the reason to set less ambitious targets, because these targets reflecting situation and reflects that more people urgently need our support. Our high-level meeting targets are fully aligned with the NTB strategy targets, but maybe more important for advocacy, for the decision makers, for the ministers and heads of states. Targets will not be reached, it's clear, but progress is still bringing hope that if COVID-19 would not happen, we would be able to achieve them. And by the end of next year, I think that the overall progress will be around 85%. More concerning is situation with the special groups like children. Access is even less, and especially children with drug-resistant TB. TB preventive treatment, let's be frank, was for many years kind of additional options, not essential, and with less attention in investments, and it's not surprising that progress is also less. I was happy to hear that now all the countries prioritizing and importance of the TB preventive treatment and broader measures, and I hope to see these measures in your plans and what is more importantly, funded. Of course, we are coming to the funding, and magic cannot happen without essential funding, and our funding gaps, global gaps, are huge. Only 5.4 million globally available out of 13 billion target. And TB research receiving literally miserable funding. And even with this limited funding altogether, we are doing great things, and there is a progress, but much more will be needed if we are looking for the new vaccines. TB determinants are drivers of the epidemic, and this is how global picture look like, and undernutrition is the key global driver. If you look at the original perspective, of course, its situation is slightly different, and we see a leading role of alcohol use, smoking, HIV, and diabetes in this order, and they should be addressed. Now, moving to the actions, again, will not repeat, very well comprehensively highlighted in the presentation of Nino, but 3 key areas will be covered. Leadership, and here we are playing all role, policy development and uptake, policy development side, task on our side, uptake jointly with all the stakeholders, and how to support countries with to drive further agenda. Again, this is a joint task. We have all the strategies in place. We have very committed leadership with Dr. Hans Kluge, with Dr. Tedros, our Director General. Strategies are fully aligned with the principles, but we are frequently saying that strategy will not end TB. Yes, it's true. You colleagues, first of all, at the first front, will do it with our support, but without strategies, it's also difficult to move forward. That's why we have them in place. We will have opportunity next year with the high-level meeting, and there will be session. I will not go into the details, but just to remind that as requested by the UN Secretary General, WHO will continue provide leadership and coordinate with all the partners, with the civil society, to provide successful preparations with attendance of heads of states and strong political declaration. We will keep you informed about the steps. We are now at the stage of adoption of the resolution on scope and modalities of the meeting, where we will see the dates, exact dates of the meetings. But I would like to acknowledge again region. We have 2 co-facilitators from your region leading the global fight. It's Uzbekistan and Poland, and we are already working closely with them. And no doubt that if high-level meeting under their leadership will be successful. Civil society is playing absolutely critical role, and we at the global level providing engagement in all key activities, and will continue doing this. Strategy for global strategy for TB research and innovations. It's another, I hope, useful instrument to drive research in the countries. All spectrum of guidelines has been updated, and our colleagues from civil society told that there've been important developments despite of the challenges, and we should be proud that now we are moving faster, process is more transparent and including almost approach like living guidelines is in place. All the tools are in digital format, and I would like also to encourage you use our digital tools and platforms as Global TB Report knowledge sharing platform and e-learning training courses. They are all available, they are free, and you can benefit. Another recent tool is a country coordination platform where you can find information from all the regions and countries about their latest program reviews, findings, and recommendations. And this is another example how we are trying to focus and address country needs. This is initiative of the Global TB Program jointly with the regional and country office. We've developed information note ensuring continuity of essential TB services for people from Ukraine facing hardships and migrating to the neighboring countries. And we will continue addressing the urgent needs. Using this opportunity, I would like to thank colleagues from Ukraine for their really great dedicated work and reaffirm in our commitments to provide all the support requested. So now almost end of my presentation, challenges, opportunities, how to transform our challenges into opportunities. This is our common task. I will not repeat challenges, but would like to say that we cannot continue doing business as usual. Environment around is changing very fast, and if we will not be aligned, if we will not be more digitalized, more effective, there is no chance to succeed. Speed means a lot. Faster we will uptake our plans, faster we will implement our guidelines, more lives we will be able to save. And even if we're applying for the resources, there are some resources available remaining from COVID response. Again, programs who will be the most proactive will be a chance to attract resources. Multi-sectoral mechanism can allow us bring additional resources from other sectors. Let's do it together, let's brainstorm and try to be efficient and effective. Joint messaging, joint advocacy is extremely important. And of course, sharing practices as you've done during these several days will help a lot to learn faster and to implement what works already. Thank you very much once again. My big thanks to colleagues from the European office, to Askari Delbaev, Stella Bivol, all the team, Nino Berdzuli, and the leadership of Hans Kluge, and to all of you. We'll be happy to continue our collaboration. Дорогу осилит идущий, as Dr. Hans Kluge is saying. Thank you.
Thank you, Teresa. I can imagine that the presentations from Nino and Teresa has raised questions, but I propose that we keep the questions till the next sessions, where there are two panels, and then there are opportunities to ask questions from the audience. So if you're okay with that, then we now go for the coffee break, and please be back at 10:55 so that we can start only a little bit late at the next with the next session. Thank you.
Azerbaijan, Dr. Nadir Zenalo, the Deputy Minister of Health of Georgia, Dr. Tamar Gabulian, the Deputy Minister of Health for Kyrgyzstan, Dr. Ulan Sadikov. Please take a seat. Any seat. Then the State Secretary for the Republic of Moldova, Dr. Svetlana Nicolescu. Then the Deputy Minister of Health for Tajikistan, Dr. Amirzoda Abidolik. Apologies for my pronunciation. The Honorable Member of Parliament from Ukraine, Dr. Lesky Oncharenko. Welcome. May we ask you to please take your seats? And the Deputy Minister of Uzbekistan, Dr. Ulugбек Sabirov. Sorry, please welcome. So warm greetings, everyone. We'll start in just 1 minute. All right, good morning, everyone. And we're pleased to welcome you back from the coffee break to this important session that reflects on country commitments made in WHO's NTB strategy, the 2018 political declaration, and of course, the new European region TB action plan. These commitments have played a major role in driving action on the ground. I'm very pleased to join you here to co-facilitate the session. I'm Monica Diaz. I'm from the World Health Organization Global Tuberculosis Program, and I lead the work on multi-sectoral engagement and accountability, on TB elimination, on public-private mix, and our DG flagship initiative, Find, Treat, All, NTB. It's a pleasure being here with my co-facilitator, Sarah Anderson, and I'll turn to Sarah to introduce herself. Sarah.
Good morning, everybody. I'm Sarah Anderson. I'm from the UK Health Security Agency. My role previously was the National Head of TB in the UK, and more recently I've been the National Incident Director for COVID, and now I'm working on a multi-program within my organization. And in addition, I am one of the TAG TB members. I'm very pleased to be here. Thank you.
Thanks, Sarah. So yes, applause for our distinguished lineup of speakers. We have Deputy Ministers of Health, State Secretary, Member of Parliament from 7 priority countries in the region. We are very pleased that all of them can be here and join us and share their perspectives. So we'll keep this as interactive as possible. Our focus of the panel discussion will be to hear back from each country on their key achievements, what progress has been made towards achieving the 2018 political commitments. And we will ask each country to make a commitment on what they would like to fast track. Looking back at the priority recommendations outlined, and you can see the slide behind me, in the UN Secretary General Progress Report that was released in 2020, there were 10 priority recommendations, and Dr. Teresa Kasayeva has already alluded to these. So we'd like to ask each country to basically prioritize and flag which commitment they would like to take forward and spotlight looking ahead. And you can see each of these listed here, all the way from activating high-level leadership, universal health coverage, addressing the drug-resistant TB crisis, financing,
research and development, strengthening civil society, community engagement, and of course, getting back on track following the impact of the COVID-19 pandemic. So with that, I'll now turn to Sarah. Sarah, would you like to take the first question, please?
Sure. So we're going to do this in alphabetical order of country. So I'm going to start with Azerbaijan and the Deputy Minister for Health for Azerbaijan. We note your focus on multi-sectoral collaboration, particularly with your Ministry of Justice and your focus on screening. But could you share one achievement that you feel your country has delivered since the high-level meeting? Thank you.
Okay, dear colleagues, dear participants, ladies and gentlemen, I would like to answer to this question by words that you have already highlighted our key achievement, which is actually the multi-sectoral achievements in multi-sectoral collaboration between the healthcare system with healthcare system stakeholders in Azerbaijan, between the Ministry of Justice, its medical service department, the penitentiary system, and the organizations of civil society. This close collaboration between these bodies and the organizations helps us to penetrate the fight with TB in our country as deep as it's possible. So I would like to say that our main achievement is this.
Fantastic, thank you. And going on from that then, looking ahead, which priority of those that we've listed would you feel you want to try and achieve in this next year?
Yes, let me inform you that I would like to stress on some of the priority recommendations listed here. Priority recommendation 2, urgently increase funding for essential TB services, including for the healthcare workforce. This is something related to the reforms of healthcare ongoing in Azerbaijan now, with the transition to system of mandatory health insurance, which helps us to scale up the salary of healthcare workforce of doctors and nurses that work also in the TB response programs. So this is one of our priority recommendations we are going to focus for the next year. Next one is priority recommendation number 4, address the drug-resistant TB crisis to close persistent gaps in care, related to something you've already seen in the presentation of Teresa, that our country is in group of countries with problem on drug-resistant tuberculosis, with high burden of drug-resistant tuberculosis. That's why this would be one of our next priority recommendations to be addressed next year. Next one is priority recommendation number 5, dramatically scale up the provision of TB preventive treatment. This is one of our weak points in the country, the involvement of people into preventive treatment and the control over their implementation of the treatment. So this is something also to be addressed. Priority recommendation number 9, ensure that TB prevention and care are safeguarded in the context of COVID-19 and other emerging threats, which we are going to design and implement, not targeted to TB response, but targeted to healthcare, public healthcare emergency preparedness and response. So if we are prepared to any healthcare emergency, not only TB response, but also other healthcare problems of public health would be addressed in this way. And the last, of course, but not least, is priority number 10, request WHO to continue to provide global leadership for the TB response, working in close collaboration with the member states and other stakeholders, including preparing for a high-level meeting on TB in 2023. This is something that we should not forget, that tuberculosis is not a problem of one country, and tuberculosis is not a problem of one region. Tuberculosis is a global problem. And to address the global problem, we need a global stakeholder that would synchronize all efforts in TB response globally. That's why, of course, this is also something that we would take as priority recommendations. The rest priority recommendations are not listed in my speech, partly because some of them are implemented or are ongoing. Some of them are not in the plan, but what I mentioned, up to our opinion, would be the main priority recommendations to be addressed by the end of next year.
Thank you very much. Very full response. Thank you. I'm now going to pass back to Monica. We'll then take the next minister. Thank you.
Thank you so much. So we've heard from Azerbaijan. Now we turn to Georgia. So I turn to Deputy Minister of Health, Dr. Tamar Gabunia. Thank you for joining us. And so the question to you, so Georgia has been making excellent progress in strengthening engagement of primary care in the TB response, integrated disease screening, as well as in facilitating the uptake of research and innovations. So a lot of progress happening there. So could you please elaborate on one achievement that the country has made that you're proud of towards achieving the commitments in the political declaration? And as a second step, which of these commitments you would like to fast track looking ahead for the next year towards the next high-level meeting? Over to you.
Thank you very much. First of all, I would like to express my appreciation for this opportunity and thank all partners here who have been supporting Georgia over the last several years in fight against tuberculosis. Of course, Georgia made commitments back in 2018 to improve care for the RTB tuberculosis, as well as improve detection and introduce more broadly preventive treatment for tuberculosis. Most prominent achievement I would like to highlight here is improved success rate for treatment success rate for DRTB patients. Back before 2015, Georgia's treatment success rate for DRTB cohorts in 2013-2014 were as low as 43%, 49%. But in 2019 cohorts, the treatment success rate for DRTB tuberculosis is 78%. This is a big achievement. This is coupled with declining incidence rate, and Georgia observed 50% decline in tuberculosis incidence for both drug-sensitive and drug-resistant tuberculosis since 2015. This has been a true decline despite some impact during COVID on the case detection process, which we want now to accelerate and get back on track with case detection. But the most important achievement, I would say, that was improving DRTB care. So what made it possible? This was due to access, universal access to life-saving treatment, and Georgia was among the first countries worldwide introducing bedaquiline with support from U.S. government donation program, as well as the Lavanid, and introduced new novel shorter treatment regimens. Big progress was made in terms of engaging primary care providers with TB case detection as well as treatment at primary care level, and we went more with integrated care approach. This is the model we want to extend in the future, as well as a very strong support, like international support from World Health Organization, USA, Stop TB Partnership, Emory University, which helped us to strengthen professional platform. And I can't just don't mention about engagement of civil society actors. What happened over the last few years, and since 2018 in particular, this was a very strong engagement and active engagement of civil society actors. We established a very successful model, follow-up model for DRTB patients, and established a very good collaboration and partnership between civil society players and National Center for Tuberculosis and Lung Diseases. And this is a model we want to strengthen and promote for the future as well. This is in brief, and of course, we have a lot of plans to continue this progress towards achieving our targets and employ truly
whole of society and whole of the government approach, because without mobilizing resources from various sectors and employing like joint efforts, it would be very difficult to meet our targets. But on the other hand, if we do so, and if we go hand in hand and mobilize needed resources, we can, of course, realistically achieve our NTB targets by 2030. Thank you.
Thank you very much, Honorable Deputy Minister. Indeed, building on your strengths, looking ahead to fast-track progress. So I'll now turn back to Sarah for the next country. Over to you.
Thank you. So turning now to the Deputy Minister of Health for Kyrgyzstan, where in Kyrgyzstan you've had some key part of your health reforms has involved decentralization. And would you now like to share an achievement which you feel is the most important for your country?
Спасибо. Глубоко уважаемые участники, дамы и господа, Министерство здравоохранения и социальной защиты населения Республики Таджикистан выражает огромную признательность Всемирному организации здравоохранения за предоставленные возможности и оказанную высокую честь участвовать в работе региональных совещаний по реализации плана действий по борьбе с туберкулезом для европейских региона Всемирной организации здравоохранения за 2023-30 годы для высокоприоритетных в отношении ТБ стран. Пользуясь случаем, также хочу поблагодарить Всемирную организацию здравоохранения и другим партнерам за тесное сотрудничество в области развития системы здравоохранения и особый вклад в процесс ее реформирования, а также оказание тесной технической помощи в усилиях страны ликвидации туберкулеза. За последние годы страна сделала ощутимый прогресс в снижении бремени туберкулеза, в частности, заболеваемости и смертности туберкулеза путем внедрения инновационных методов лечения и ухода за туберкулез, новых коротких режимов лечения, быстрых молекулярно-генетических диагностических исследований, оказание психосоциальной поддержки с привлечением всех секторов и партнеров, включая организации гражданского общества и сообществ, затронутых туберкулезом. Если акцентировать внимание на одном из основных и значимых достижений, то хотелось бы остановиться на высокой политической приверженности правительства к ликвидации туберкулеза. Национальная программа защиты населения туберкулеза в Республике Таджикистан утверждается на уровне правительства и носит многосекторальный и многодисциплинарный характер. В частности, национальной программой в 2021-2025 годы является пятой по счету. Таджикистан осознает значимость координированных действий с привлечением разных секторов и партнеров в ликвидации туберкулеза. Поэтому в стране функционирует Национальный координационный комитет по профилактике и борьбе с туберкулезом и ВИЧ, который возглавляется заместителем премьер-министра Республики Таджикистан. Заместителем данного комитета является министр здравоохранения и социальной защиты населения. В Национальный комитет также входят представители разных государственных секторов, агентств ООН, доноров, международных и общественных организаций, сообществ и лиц, затронутых ВИЧ и туберкулезом, а также представителей религиозных организаций. В функции Национальный комитет, в частности, входит усовершенствование национальной стратегии и осуществление регулярного мониторинга выполнения национальных и стратегических программ. В 2023 году Министерство здравоохранения и социальной защиты населения и правительство Республики Таджикистан привержено продолжить многосекторальные и скоординированные ответные меры по ликвидации туберкулеза с особым акцентом по обеспечению всеобщего охвата услугами здравоохранения для обеспечения доступности недорогого, качественного медицинского обслуживания для всех людей с туберкулезом. В частности, мы привержены в дальнейшем расширению, внедрению быстрых молекулярно-генетических диагностических исследований в качестве исходных тестов для диагностики туберкулеза. В сотрудничестве с Всемирной организацией здравоохранения и другими партнерами мы продолжим лечение людей новыми эффективными препаратами и по новым лекарственным схемам. А также мы привержены в обеспечении других потребностей людей с туберкулезом, включая психосоциальные, нутриционные и иные поддержки. Мы продолжим расширение систематического скрининга на туберкулез и профилактическое лечение туберкулеза. Понимая важность проблемы принятого плана действий и обеспечения санитарно-эпидемиологической безопасности, мы высоко оцениваем вклад партнеров по развитию Всемирной организации здравоохранения, Глобального фонда для борьбы со СПИДом, туберкулезом и малярией, ЮСАИД, партнерства «Остановить ТБ» и других в деле совместной борьбы с туберкулезом в Таджикистане. Надеюсь, что результаты работы нынешних региональных совещаний также будут позитивно влиять на процесс борьбы с туберкулезом как в каждой стране, так и в регионе в целом. Поскольку сегодня у нас отмечается День флага всех народов Таджикистана, мы хотим, чтобы флаг каждой страны всегда был ярким. Благодарю за внимание.
So congratulations as you celebrate your special day, Dr. Amirzoda Abidolek, Honorable Deputy Minister of Tajikistan. So we'll now next turn to the Republic of Moldova, and then we'll come to Kyrgyzstan after that. So now we turn to the Republic of Moldova. We commend Moldova very much for prioritizing people-centered care. They've also made a lot of strides forward on meaningful engagement of civil society. So I turn to Dr. Svetlana Nicolescu, State Secretary, could you please elaborate on one achievement that your country is proud of in terms of achievements in achieving the 2018 political declaration? And then as a next step, if you could highlight what your country commits to from the priority recommendations in the Secretary General report looking ahead to 2023. Over to you.
Thank you, distinguished participants, dear colleagues. It's a great pleasure. And I would like to start expressing the words of thanks to all partners in international community who have been provided support to the Republic of Moldova for effective TB response at the national level. As has already been mentioned, Moldova has prioritized TB response at all levels, at the levels of strategy, at the levels of policy, at the levels of actions, and it brought us to some achievements we are proud with today. And the one that I would like to highlight for our today discussion is implementing the people-centered model of TB care. It sounds maybe simple, but it's really imply a lot of efforts and work in order to ensure the turning around of the health system itself and bringing in the focus people with TB. So what we have been achieved in Moldova is turning the focus from disease to the people. Today in Republic of Moldova, all people with TB have universal access to modern TB diagnostic. We also have all means to provide diagnostic for antimicrobial resistance to all TB drugs. We can proudly say that today in Moldova, the model of care We use the short treatment regimens and fully oral regimens for TB care. And most of all, one of the most important things that all this medical care is supported by social services and all the other services that TB people are in need. How it was possible to achieve, of course, it meant to build strong coalition, both at the governmental level, but also with civil society and with international partners. So it's only through these joint efforts we could achieve these results. But the age of thermal crisis that already has brought in the discussion today show us how fragile can be all these achievements, how vulnerable and how unstable they can be in the period of crisis. We have seen the effects, the impact of pandemic, and currently the European region is facing an unprecedented humanitarian crisis. And we already see how fragile our achievements in public health, including TB response, can be in this time. Republic of Moldova has faced one of the highest refugee rates among all recipient countries of migrants. Since the war in Ukraine has started, Republic of Moldova, the borders of our country has been crossed by more than 6,800 refugees, and currently in our country stay more than 85,000 of refugees from Ukraine. It means a lot to our country, but the thing that needs global and international attention are the additional risks to the societies, to public health, to TB response as well. Just to give you the sense of the situation at the neighboring countries with Ukraine, just yesterday, due to the Russian strikes, the whole country of Moldova went into the dark. So it was the strikes of the energy infrastructure, the power infrastructure, and it took hours to our country to re-establish their power, including in medical institutions, including in hospitals, including to people who need medical care. So these times of thermal crisis need our very strong commitment and very flexible mechanisms and tools and responses at all levels. Going back to the commitments that we would like to prioritize for the next period, it relates to ensure that TB prevention and care are safeguarded in the context of COVID, but also the other emerging threats, and including the current humanitarian crisis that the region is facing. So we will prioritize TB. We will include TB in our contingency and response planning. The most important that all these actions need to be anchored to the strategies, and Moldova has the National Development Strategy, European Moldova 2030, where TB is prioritized in line with the targets from SDG 3, and we will channel all our resources and capacities and efforts to make sure that we will achieve these targets, including for TB. So Moldova would like to reassure our commitment, and we will do this in line with the European values of human dignity, equity, human rights, and peace. And as well, the actions of our country will be guided by a clear commitment to a European path, the choice that Republic of Moldova reconfirmed in times of war and hardship. Thank you.
Thank you very much. Thank you for your strong commitment and in the time of crisis, and also for underlining again the importance of people-centered care and for reassuring us of your commitments. So we now turn to Kyrgyzstan, and I'll turn to Sarah to introduce Kyrgyzstan. Over to you, Sarah.
So we're going back to Kyrgyzstan. Yes, sorry. So Kyrgyzstan, welcome, Deputy Minister. You've made some great key commitments to decentralization. So if we could hear what you feel is your one achievement since the last high-level meeting. Thank you.
Спасибо, Сара. Я хотел бы поприветствовать участников сегодняшнего мероприятия, выразить особую благодарность Министерству здравоохранения Турции за организацию на таком высоком уровне этого мероприятия, партнеров наших, ВОЗ, ЮНИСЕФ, Глобальный фонд, наших коллег, за то, что принимают все совместно серьезные усилия по борьбе с туберкулезом. Отвечая на ваш вопрос, я бы хотел сказать следующее. У нас есть свои достижения. Одним из них, которые мы можем, по крайней мере, на сегодняшний день гордиться, это изменение статистики в сторону улучшения по эффективности лечения туберкулеза у нас в стране. Начиная с 2017 года Кыргызстан, являясь, естественно, политическим приверженцем всех изменений, всех реформ в мире, применила изменения, реформаторские изменения, когда мы начали достаточно быстро, достаточно, можно сказать, эффективно применять новые методы лечения, использование новых препаратов, изменение формата лечения и так далее. И статистика показывает, что если сравнивать 2016 год, процент хороших результатов при лечении был в районе 50. Через какое-то время, ну, точнее сказать, в 2019 году статистика изменилась в сторону улучшения. Мы уже показывали цифры 73%. Особая гордость в плане улучшения статистики при лечении краткосрочными курсами. Это все является тем, что мы в Кыргызстане будем внедрять новые технологии, новые методики лечения туберкулеза. Что касается других показателей, у нас с 2017 года принята в Кыргызстане дорожная карта, которая была юридически закреплена постановлением правительства о улучшении мер в борьбе против туберкулеза. Согласно этой карте проводились определенные реформы. К примеру, у нас в Кыргызстане были сокращены стационары, которые оказались в какой-то части неэффективными. С 25 стационаров количество уменьшилось до 19. Высвободившиеся средства, это в районе около $1 миллиона, мы смогли направить на улучшение оказания противотуберкулезной помощи на первичном уровне. Часть этих средств были потрачены на покупку новых препаратов первого ряда, практически весь ассортимент, частично второго ряда. Удалось небольшую часть из этих средств использовать для мотивационных выплат на первичном уровне, что тоже является гордостью на сегодняшний день. И это показало свою эффективность. Сейчас пилотные проекты закончились, и этот проект у нас в Кыргызстане будет уже использовать как рутинный процесс. Все регионы страны уже применяют эту методику выплат. И даже могу озвучить цифры. Около $150 выплачивается на эффективно пролеченный случай. при чувствительной форме туберкулеза. Около $300 для сотрудников первичного звена выплачивается для лекарственно-устойчивых форм. Поэтому данные изменения, данные внедрения у нас дают определенный эффект, и мы этим очень сильно гордимся. Спасибо.
Okay, thank you. Thank you very much, Honorable Deputy Minister. We now turn to Ukraine, and we stand very much in solidarity with the people of Ukraine who've overcome, several challenges and still made progress in combating TB. So our hearts are with you, and really great to see the advances made in taking forward multi-sectoral engagement and accountability, the engagement with parliamentarians who play a big role. And this is why we're very pleased to have with us a member of parliament from Ukraine, Mr. Oleksiy Oncharenko. Sorry for my pronunciation. So I turn to you. We commend the country for your progress in this time of conflict. Could you please elaborate on one achievement that the country is proud of towards reaching the commitments outlined in the 2018 political declaration? And looking ahead for the year ahead, what is the one commitment from the recommendations made in the Secretary General's progress report that you would like to fast track towards reporting back in 2023 in terms of commitments? So over to you.
Thank you. Thank you very much. First of all, it's a great honor for me to be here, both as a member of Ukrainian parliament, as a member of Global TB Caucus, and last but not the least, as a doctor by education who worked at ambulance and saw what is a big challenge is to TB for the whole world and for humankind. So speaking about Ukraine, first of all, I should start with thanks to World Health Organization for all your constant support of our country in this extremely difficult for us time of Russian aggression against our country. I want to thank special thank to Regional Director Hans Kluge, who is now in Ukraine, and yesterday and today he sees by his own eyes the consequences of these barbaric terroristic attacks on missile attacks on Ukraine. Yesterday, just for example, unfortunately, many hospitals are also targets of these attacks. And yesterday, in the Zaporizhia region, the maternity ward was attacked, and a newborn boy was killed. And yesterday, we had almost complete blackout in the country because of Russian missile attacks on Ukrainian energy infrastructure. And also all hospitals in the country were and partly still are without power supply. And you can just only imagine what a huge challenges it makes for our doctors and nurses and in what conditions they work. And again, thank you for all support in this situation. But even in such harsh conditions, Ukraine continues to show leadership. Thanks to our Center of Public Health, Ministry of Healthcare, but first of all, to thousands of doctors and nurses throughout the whole country who are doing their duty and doing their best in this situation. Unfortunately, because of this, we now have a unique experience of work in such difficult circumstances. I hope never ever any country in the world will need this experience, but if it would happen, we're absolutely ready to share this experience, to be together with you, to give you our hand, to support you. Speaking about our most important things that we are doing on the level of the parliament, certainly it's legislation. And now Ukraine is preparing a new tuberculosis law, a national TB caucus headed by my colleague Lada Bula. He's actively involved in this process. And we hope that will be a real model for many countries, and can also use our experience in this direction. Also, certainly I would like to say that we believe that United Nations high-level meeting next year can be a very, very strong step towards achieving our goals of end tuberculosis. But to do this, we need to prepare for this meeting, what we are doing now. And together with our colleagues in Global TB Caucus, we are now working on the key asks for United Nations high-level meeting declaration. So the challenges are enormous. You know, the rates of tuberculosis, the rates of drug-resistant tuberculosis, all these shows us that it's time not only to speak, but to act and act actively and globally, because this is a global threat, and tuberculosis is a social disease. So counting this, we understand that only by combining efforts of doctors, government, parliament, non-government organizations, we can together tackle these challenges. We can together achieve these goals of no tuberculosis and to open this new chapter in the history of humankind, chapter free from TB. We will do everything we can in this direction. We are ready to support implementation of MAF TB, which is very important, you know, and being the only parliamentarian in this hall, but I'm sure I'm speaking on behalf of all parliamentarians of all your countries. We appreciate what you do. We are ready to be your partners, and we are ready to win this war together with you. Thank you very much.
Thank you very much, Honorable Member of Parliament, Dr. Oncharenko, for your passionate intervention and showcasing the work that your country is carrying on despite several challenges. Thank you very much. Over to you now, Sarah, for the next country.
So turning now to Uzbekistan. Thank you very much for working to co-facilitate the UN high-level meeting next year, and particularly for your work to increase access to treatment. But from your point of view, what do you feel is your one achievement that has brought you from the last high-level meeting to where we are today?
Ассаламу алейкум, hurmatli hamkasblar. Добрый день, уважаемые коллеги. В первую очередь я хотел поблагодарить Всемирную организацию здравоохранения, ее партнеров, организацию столь высокого мероприятия, которое способствует тому, что мы объединились, мы работаем в одной команде, в одном направлении и думаем одинаково. И то, что вы сказали, значит, изменения по туберкулезу в мире, то есть то, что мы сегодня слышали, то есть это убийца, который убивает 1,6 миллионов людей каждый год. То есть если COVID мы посмотрели за 2 года, что было, а туберкулез, он тихий убийца, который убивает. И поэтому каждая страна вносит свою лепту, работает в борьбе с этим заболеванием. В последние годы Узбекистану удалось достичь значительного прогресса в преодолении медико-социального бремени от туберкулеза. За период за 2014 и 2021 года, благодаря целенаправленной работе по охране здоровья населения от туберкулезной инфекции и предупреждению распространения, своевременной диагностики и лечению в рамках международных стандартов были спасены около 120 тысяч жизней. Я хочу повториться, в рамках международных стандартов, которые разрабатываются Всемирной организацией здравоохранения, партнерами, которые, и согласно которым мы работаем, и это спасает, это большое дело. В результате реализации мероприятий, предусмотренных программами государств и международных партнеров, удалось снизить заболеваемость от туберкулеза на 23%, а смертность на 64% по сравнению с 2016 годом. Основные приоритеты программы по контролю туберкулеза в Узбекистане позволяют гарантировать обеспечение всеобщего доступа к раннему выявлению и диагностике туберкулеза, обеспечение всеобщего доступа к качественному лечению всех форм туберкулеза, расширение охвата профилактическим лечением туберкулеза, улучшение доступа ключевых групп населения к комплексным услугам по профилактике, диагностике, лечению туберкулеза, создание благоприятных условий по оказанию медицинских услуг. И согласно новым протоколам стандартам, Узбекистан полностью отказался от инъекционных лекарств, то есть мы применяем это профилактическое лечение, это короткие курсы, которые способствуют тому, что раннее предупреждение. И значит, ключевые достижения Узбекистана, согласно постановлению президента Республики Узбекистан, с 2020 года закуп противотуберкулезных препаратов первого и второго ряда из средств государственного бюджета осуществляется посредством международного механизма GDF, который гарантирует поставки в страну качественных переквалифицированных препаратов. На эти мероприятия в 2021-2020 годах государством было выделено $4 миллиона. Кроме того, в проекте нового постановления на 2023-2026 года заложены средства на закуп стопроцентной потребности против туберкулезных препаратов первого ряда, 50% потребности препаратов второго ряда. И весь закуп планируется осуществлять посредством механизма GTF. На эти мероприятия ежегодно планируется выделять 3,8 миллионов долларов. В качестве ключевых обязательств для сосредоточения внимания в 2023 году Республика Узбекистан полностью задействует руководство высокого уровня для снижения смертности от туберкулеза и проведения многосекторальных действий, чтобы покончить с туберкулезом. Направить усилия для преодоления кризиса лекарственно-устойчивого туберкулеза, чтобы устранить сохраняющиеся проблемы в лечении. Значительно увеличить масштабы профилактического лечения туберкулеза в стране. И мы остаемся политически приверженным. То есть мы политически приверженными и работаем в одной команде со всеми международными организациями и Всемирной организацией здравоохранения. Спасибо вам.
Thank you very much for that intervention. And I'd like to draw this to a close. I would very much like to say thank you to all the Deputy Ministers and our Member of Parliament. Thank you for all you do for TB, hugely important. And actually that political commitment is important for us to end TB. And this year is important as we work towards the high-level meeting. So thank you very much for coming today. Thanks for sharing your commitments, for your priorities for the future. We're all very pleased to have had you. Thank you very much.
Thank you very much. Thank you. We'd now like to move to the next session. The session is on community rights and gender, and I'd like to invite Dr. Virel Sultan from Stop TB Partnership, who will be facilitating the session. And we'd also at the same time like to invite the panelists, Christina Selan, Elena Zirnova, and Timur Abdullayev to please come take the stage. Thank you. And Paul Summerfield, please.
Thanks. Paul, can you join us, please? Thank you. Good morning. Good morning. How are you today? Are you good? Excellent. Great. So we have a very exciting session coming up. Paul, I would like to invite you to kick off this session. Paul Summerfield, TB Europe Coalition, will reflect a little bit about meaningful engagement of the civil society in WHO European region, challenges and opportunities. Paul, over to you.
Thank you very much, Virel. I seem to be merged into the community rights and gender group all of a sudden, which is I'm very happy with. We in TB Europe Coalition are very much engaged in CRG work. I should also say, though, that my presentation, we've changed the title slightly from what is in the program, talking about engagement of civil society at regional level within WHO Europe. And the reason for that is that it would be too broad a subject to try and talk about civil society engagement across the whole of our region in every one of the different countries. But there are significant things to be said about what is happening at regional level. Next slide. I'm not sure. No. as an overview of what I'm saying, there has been a lot of progress in terms of community engagement in recent years in our region. But as I was saying in my opening remarks earlier this morning, civil society organizations and affected community groups remain relatively underused. We could do an awful lot more if the circumstances were right, particularly in terms of implementation and delivery of services. And that's why we were very happy to see in the action plan, which we are all working on this week, if you look, let's go to the next slide. If you look at Pillar 1, Priority Action 3, on which we all worked on, I think, was it on Monday or Tuesday? It says, ensure meaningful engagement of civil society and affected communities and scale up community-based TV services through direct and social contracting mechanisms and funding for strengthening community systems. What that wording underlines are the importance of civil society contribution to the work against tuberculosis, but it also underlines the need for funding mechanisms to make a reality of that. Next slide. And so just a brief reminder of what civil society can do. Everything around the area of community awareness, building knowledge of TB and its symptoms and available services, where are they, how to get to them, and that awareness should be present in the higher at-risk communities. We can help with prevention, helping with and understanding of and adherence to TB preventive therapy. We can help with diagnosis, often rather under-focused on the difficulty of making sure that individuals link with and go through the processes of diagnosis. So helping individuals find their way to diagnostic services and even direct help with specific things like sputum collection. And then during the period of treatment, supporting individuals through those long and difficult months. And they're still long. I mean, even now that we are seeing shortened treatments beginning to come in, we are still looking at 6 months as normal, at least 6 months now for both drug-sensitive and drug-resistant TB, and the possibility of 4-month treatments very much in the near horizon. We can also assist with palliative care and the rehabilitation of individuals who have undergone treatment as they get back into normal life. And of course, we get involved in advocacy, our more traditional activity, helping to ensure that both the public in general and government support TB action against TB. But as I said a moment ago, a primary difficulty is funding. The great difficulty for civil society is that we don't automatically fit the normal funding mechanisms. We're not the sort of thing for which there are traditional channels of money coming out of your Ministry of Finance, let alone other routes. And where there is some funding, of a local nature, it tends to be grants. And grants are nice, but grants tend to be occasional and uncertain. Sometimes from international sources like USAID and Global Fund, they can be big and they can keep things happening for several years, but they still are not long-term sustained. And so for me, a particularly important output from the work that we in TBEC, together with PAS in Moldova and WHO Europe, were able to prepare during the Global Fund TB Rep 2 program was a fully developed tool for standardized packages of care in TB provided by civil society organizations. And that concept of a standardized package opens up the possibility not of granting because you think something is nice for a time, but of contracting for a specific, known, defined service. And that is something then that national health insurance agencies or ministries of finance can comprehend, can know what they're paying for. The civil society organization knows what it has to provide and can be monitored as to whether it is providing it. And the result then is regularity of contracting, sustainable funding. So we're happy that of the ECA countries, already there are 4 that have formally adopted these packages, 4 that are actively working on doing so, and a couple more which are at least beginning to look at them. But turning now to regional mechanisms for collaboration. Of particular importance here is the Regional Collaborating Committee, and to give it its full name, the Regional Collaborating Committee on Accelerated Response to TB, HIV, and Viral Hepatitis, RCC. RCC has been around since 2012, originally founded to deal with tuberculosis, and since 2018 has also covered HIV and viral hepatitis. It provides an unusual source of strength in our region, an unusual mechanism. A regional formal body convened by the regional WHO agency to facilitate collaboration between civil society and WHO itself and national programs and other significant partners relating to all 3 diseases. And so now to just list a few of the things that the RCC has been involved in the last 2 or 3 years. One thing that we're particularly excited about is that we managed to persuade our friends in WHO that when you're looking at the WHO national review missions, that among the sources of expertise you need to have represented on those mission teams is both the experience of someone who has had TB themselves, but also the experience of people who are good organizers of civil society activity. There are some very good individuals around, like Timur on my left, and Safar, who was with us earlier on, who combine both those levels of expertise. But it is not that common to have both in one person. And it is useful for the WHO, and WHO Europe has now agreed that in any review mission, there should be somebody from affected communities and somebody from civil society organizations. We have then, in RCC, we helped to develop the TORs and develop a roster, 2 rosters, one for each of those categories of individuals who WHO can call on to draw into WHO missions. And indeed, only a month ago, we were involved in a training program for individuals who might be drawn into such missions. RCC has also been involved in consultations leading up to this action plan and the equivalent action plan for HIV, hepatitis, and STIs. There was also a consultation early on in March relating to what could civil society together with WHO be doing as far as Ukrainian refugees. And we issued a call to action calling on governments and national programs to help ensure the continuity of TB treatment and indeed HIV and hepatitis treatment too. A particular area of contribution has been in our development of civil society indicators that you heard more about on Monday in the multi-sectoral accountability framework. We have also did a whole bunch of work on psychosocial support, which has been relatively under-focused in our programs. And we also issued at the time of the beginning of the pandemic, a call to action in March of 2020, so almost as it started, helping to focus attention on near there. And we have just some challenges facing us at the moment. We want to contribute to the monitoring framework for the action plan. We need to maintain commitment both by WHO and CSOs to the RCC. And we need to ensure that the RCC responds not only to our world of TB, but also to our colleagues in hepatitis and HIV. A particular issue at the moment is there's a Global Fund formal policy, which at the moment is not supporting civil society regional activity in TB, and there's a lack of other funding streams. So lastly, to close, I would just like to say thank you, particularly to Sayed Hassanova, who from WHO Europe, who is the backbone of the RCC and makes sure that it actually happens. To Askar Yedelbayev and the others in his team for their constant support. To my colleague, the Vice Chair of the RCC, Leila Kosmaro from Milan, who focuses our interests in HIV. And to Yulia Chorna, who was once the Executive Director of TB Europe Coalition and is now a consultant to the RCC. And to all members of the RCC in their engagement with WHO, with other partners, uniting in our work against TB. Thank you, Chair.
Thank you. Thanks, appreciate very much, and thank you for your leadership in the region, Paul. We heard this morning from esteemed deputy ministers of health from the governments, their steps in terms of achieving the targets and so on, and Paul was instrumental in bringing the perspective of the civil society in here. For the next session, we are going to discuss a little bit about barriers to services from the perspective of CRG. Can you please take your phones? Phones. I want to see phones. Scan your QR code that you have, either here, either on your tags. Please, there is Slido there. Go to that Slido part. There is a question. And the question say, how would you define community rights and gender with one word for you? Please. Community rights and gender with one word. Great. We are doing great. Excellent. Equality, essentials, justice, social justice, fundamental, dignity. Come on, come on, come on, come on, come on. Nice. Excellent. Humanity. We are people. That's one word. Права. Critical. Basic. Человек. Excellent. That's amazing. That's exactly what we are going to discuss. Thank you so much for your participation. Andrei, if we can pull up the slide. Thank you. Excellent. Equity. Equity. we have a nice slide to kick off the next discussion. I will try to engage you all, so be ready. I will come to tables, ask you questions. Be ready. This is the slide. Take a look at this slide. This is about some kids here, right? They want to see the football game. They have a fence in front of them, right? This fence. What is this fence? It's a barrier. Because of this fence, they cannot see the football match, right? It's a barrier. Let's imagine that these are people with TB and they need to access TV services, and there is a fence inside of them. This is the reality that we have right now in our countries. This is the reality. Some people are there, you see? Some people are there because they have full access to everything. But we have a lot of people in our countries that are here. Who are those? Who are these people? These are key and vulnerable. These are those that have barriers to services. These are the missing people with TB. We don't find them, we don't diagnose them, we don't treat them because they are key and vulnerable populations, right? Is it logic? Simple. Now what? These boxes, you know what these boxes are? This particular box is your domestic funding. And these particular boxes, it's like the Global Fund funding. You see the table there, they are very important people, the Global Fund one, because they give us these boxes. So these boxes are resources that we, together in our countries, need to address. You are smart, right? All of us are smart people in this room. We are managers of the programs, of our programs in our countries, right? We are those that distribute these boxes. We are those that create our programs in our countries to put these boxes right. If we put these boxes right and do equally to everybody, what we have? We still have the same problem. We don't say solve the problem with the key and vulnerable populations. They are still have barriers to services. They are still missed, not diagnosed and not treated. Is it simple? What do we need? We need to put more money for them. We need to put the right boxes in the right place in order to give them possibility to have access to our services, right? This is what is it about. This is about our programs. This is how to address the barriers to services in tuberculosis, right? Of course, ideally, we would like to take out the fence and have access, equal access to everybody. But in the meantime, we need to play with these boxes. We have an awesome panel here that we will try to do this interactively. And I will ask first Christina to explain a little bit about this fence, to explain a little bit about these barriers, and what was your experience in assessing and addressing these barriers in the region? Christina, over to you.
Thank you, Viorel. Good day, honorable auditory. During the past 3 years, I really enjoyed the presentations from countries, from partners, showing so much progress in the region. And I enjoyed the fact that we have good plans, we have new tools, we have great minds and committed people here in the room and in the countries we are working with, but still every 25 minutes, someone dies of TB in our region. We still face poor treatment outcomes we are accountable of almost a quarter of the MDR-TB and 40% of the pre-XDR-TB in the world, our region, when saying we. And the most important, we even do not find all those who need the care. So as we saw in the Global TB report, and Georgi also presented on Monday, the gap of people, of missing people with TB is increasing during the past years. Of course, we understand that there have been many factors that influence this, and we had COVID, we had reduced financing from our region, but still, even before the COVID, the situation was far away from perfect. It means we have room for improvement, and this might be because there are gaps also in the way the health services are delivered or organized, as far as they are not reaching everyone. And when something is not going well, maybe we should stop and ask those who are accessing those services why they are not accessing them, why they are accessing, why they are not completing the treatment. And maybe in this way, we found which are the special needs that are not taken into account when organizing the service delivery. This is what we say, and we call CRG, Community Rights and Gender, C from community, which means strong partnerships, strong alliances with the civil society, with the community-based organizations. The moment when we put people with TB and their communities in the center, involving the TB response, hear their needs and their warnings of what is preventing them to access health services. R, we have from the rights, and that means that we ensure that during all the TB journey, the human rights, including confidentiality and dignity of the people, are respected. And G is from gender, and which means that our interventions are gender responsive and promote and protect the gender equality. To make our life easier, Stop TB Partnership developed a few tools that help us in assessing those CRG barriers, which in 2019 have been consolidated in one consolidated tool for CRG assessment. Also in 2020, we had the TB stigma assessment tool, which helps us to measure the level of stigma in countries. Those tools are very simple and are designed for the implementers in the country and the national programs to inform on the current and perspective support and review of the national policies and guidelines. The key success in applying those tools is that they are applied in partnerships. They are applied in partnership of the governmental stakeholders, that means Ministry of Health, national TB programs, civil society organizations, and TB-affected community. Why in partnership? Because the TB communities have the information and their lived experience from the ground. The civil society organizations have the capacity to reach those affected and also to manage the process of the assessment. And the Ministry of Health and the NTPs should be involved from the very beginning and should be committed to use those findings in order to address the barriers related to and to make the services more available, acceptable, affordable, and qualitative for all. In our region, we had several CRG assessments in Armenia, Georgia, Kazakhstan, Kyrgyzstan, Moldova, Tajikistan, Ukraine, and almost all of these reports, except Armenia and Moldova, which were not yet available in 2020, were analyzed in a regional overview which gave us an understanding which are the common problems or common gaps in our region in service delivery. So we saw that the needs of key populations, and especially of people with history of imprisonment and people using drugs, are not fully addressed. People hesitate to address health care services because of criminalization, lack of documents, registration, and especially women from those populations are highly stigmatized. Women with TB in generally have to overcome larger barriers such as scarce of finances and catastrophic costs, lack of support and lack of family support, gender-based violence, self-stigma. They're going through divorces, separation from children, discontinued pregnancy. There is still stigma from healthcare workers for these key populations, and even there is stigma against healthcare workers working in TB from their peers. TB care is not fully people-centered in our region. So the only available option for treatment is still DOT, even in the countries where we have video-supported treatment, not all the time. And usually the key populations are not meeting the criteria to be included or to give them such option for treatment, which is more accessible for everyone. The role of primary health care is still to be strengthened. So the knowledge on TB and the infection control should be improved. There is also lack of motivation of primary health care and the time and skills to work with the key populations. On the perspective of people assessed, there are limitations regarding the job security, and also we have delayed diagnosis, challenges with treatment support in rural poor population. Of course, all these findings come with clear recommendations which countries took into account and already applied to address those barriers. And we have the example of Georgia, who took the findings of the CRG assessments to improve and strengthen the cooperation between governmental and non-governmental stakeholders, and especially including CSOs in promotion of TB awareness, education of patients. Also, the activities included in the costed action plan, CRG costed action plan, were taken on board when preparing the funding request for the Global Fund. Also, to document routinely the barriers, they adopted the CLM One Impact tool. We have Kazakhstan, which developed a case-managed algorithm with the due account of gender aspects. They are doing advocacy for allocation of state funding, of local public authorities funding, and also they adopted and roll out the One Impact CLM2. We have Moldova, which took into account the findings of the CRG assessment when revising the TB law, which is currently ongoing. So countries like Armenia, Kazakhstan, Moldova, and Tajikistan developed the CRG costed action plans. These are plans which come with clear activities that can help to address CRG barriers. They come with the budget. I am sure that all of you here in the room know about the existence of these documents because they were done in partnership with the NTPs, with the governmental stakeholders. One thing, just when you do not forget about them, when you develop your national strategic plans, your national programs, your funding request to the Global Fund. So once we have these guiding documents responsive to CRG needs, people working in TB response is informed and trained on the specific needs of each key population. Then we start paving the path for each in need to find acceptable, affordable, available, and qualitative services that they will be willing to access. Thank you.
Thank you, Christina.
Thank you so much. So we hear about the tools, that there is a tool available. Those, and there are many countries that did CRG assessments. So basically, you know the barriers of services. Let's address them. Some countries already developed plans, CRG action plans. Those who didn't, we need to do them. So this is the message. Think about the fact that we have the barriers there. We need to know them and we need to address them. Thank you. Appreciate Christina. Next, Elena. Elena is coming from Kyrgyzstan. They are champions in providing community-led monitoring. So let's hear about what is community-led monitoring and why we need community-led monitoring.
Thank you, Varel. Hello, dear participants, colleagues, friends. It's my pleasure to be here and participate in such a great event. In continuation of what Christina has told us about the periodically assessment of barriers that people face during TB journey, we can also improve TB response by routinely collected data by the community using different tools, including the digital ones. And such kind of tool is One Impact platform. This is community-led monitoring alert system that empower people affected by TB to claim their rights, to access health and support services, to report and eliminate TB stigma and discrimination. When services are not accessible, available, or of poor quality, people affected by TB can very rapidly notify the health system about the gaps using this platform in real time. Once the notification is reported, the system automatically informs, thank you. The system automatically informs the responder team and NTP about the gaps so they can monitor the trends and close the gap in number of people who fail to receive services. In Kyrgyzstan, we have been implementing such community-led monitoring tool developed by Stop TB Partnership and adapted to the country context within TBREP 2.0 regional project supported by PASS Center and financed by the Global Fund since 2020, and of course in close collaboration with our national TB program. This mobile application is very easy in use and can be easily downloaded and installed on the patient smartphones. And due to the 4 components of the application, people affected by TB now have an access to the reliable information about TB. They can very rapidly find the nearest health facilities and address their medical needs. They stay connected with peer consultants, doctors, and the community. And the most important, they can raise various issues to show the gap in access and quality of services. After have been implementing this application during almost 2 years, now we have more than 2,000 users registered in the system, with around 1,000 cases reported by the patients, and mostly those cases include questions related to TB drug side effects, economic burden related to TB, stigma and discrimination, and request of food and social support. By reporting in real time and monitoring the barriers preventing people from being diagnosed and treated, the country can generate the evidence that can be used to immediately address those barriers and in turn reduce people's vulnerability to TB infection, increase access to TB services, and improve TB treatment outcomes. All reported barriers, they are collected and analyzed in a dashboard panel. This is web-based model that allows NTP to collecting people's feedback, increase access to services, and respond to the gaps revealed through the application very quickly. For example, in our country, we received the message from the patient who reported us that TB drugs were out of stock when she came to take her medicines in TB facilities in the remote region. And we were really surprised to have this message because we know that in our country, we do have TB drugs which are available in every region and in every TB facility. Of course, we contacted immediately the patient to find out more details, and we informed the NTP about the case. And it turned out that the problem was caused by logistic interruption. And due to the quick reaction from the sides of NTP, the drugs were delivered to the TB facility the same day. Moreover, as mentioned before, our national TB program is very open and very supportive in promotion of innovative approaches and in collaboration with civil society and community-based organizations. NTP representatives, they have been participating in promotion of the One Impact application at every stage of its implementation in the country. And since 2021, the ownership of the application was transferred to NTP with an access to the dashboard panel. And monitoring and evaluation department of NTP always records feedback from the patient. And additionally, we provide quarterly reports to NTP about the cases we receive and about the feedback that we receive from the responder team, which NTP uses to increase quality of TB services. And in conclusion, as you can see, on the one hand, this LM tool helps people affected by TB to claim their rights, but on the other hand, it is also helpful for NTP to monitor the trends and develop the strategy based on real people needs. And I think that if we really want to ensure sustainable TB response, we should make sure that people's needs are presented, they are understood, prioritized, and responded to. Thank you.
Thank you, Elena. Thanks very much. So there is a fantastic tool outside. By the way, the tool was initiated in Tajikistan, and Tajikistan started to work on this first country in the world. Safar, you see, our champion is there. He was at the beginning of developing of this tool. Thanks a lot. What is interesting, some countries already started to do this in the region, and it's very interesting. For example, Ukraine took that, and Ukraine recently received a global award for implementation of the one impact in the country for community-led monitoring. This is amazing. So those who are not, please talk to each other, because the tool is fantastic and we should use it. And the tool is exactly as Elena said. We need to ask people to understand their needs, to put the right boxes in the right place. Thanks, Elena. And the next speaker is Timur Abdullayev, TB People Global. He is originally from Uzbekistan. I guess everybody knows him. Timur, why we need to engage communities? Why we need people?
Можно я по-русски? Добрый день, уважаемые коллеги. Спасибо, VRL, за этот неожиданный вопрос. Можно слайд? Сегодня, я так понимаю, мы будем неоднократно упоминать Сафара. Здесь фотография, которую я снял сегодня на сессии, которая была в начале сегодняшнего дня. Я подумал, что достаточно символично она отражает, куда мы движемся. в каком направлении. Сафар на этом снимке находится с краю, но первый. То есть, если мы говорим о том, что люди должны быть на первом месте, то, в принципе, все нормально. Но все-таки подход, к которому мы движемся, предполагает, что люди, затронутые туберкулезом, должны быть где? В центре. Спасибо. Но, по крайней мере, и я это подчеркиваю, мы находимся на правильном пути, потому что я помню время, когда для того, чтобы оказаться на панели с высокими гостями, высокими выступающими, нам приходилось, в общем-то, отстаивать. На самом деле, до сих пор нам иногда приходится доказывать, что мы должны быть. Что если мы обсуждаем туберкулез, мы обсуждаем эпидемии, то люди, затронутые этими эпидемиями, должны быть. Эти бои, к сожалению, до сих пор продолжаются. Как знают лично некоторые присутствующие в этом зале, в том числе из Глобального фонда. Вот. Но я надеюсь, что этих боев больше не будет, и что люди, затронутые туберкулезом, будут участвовать в обсуждениях по тем вопросам, которые их непосредственно касаются. Более того, да, а теперь к вопросу, а почему? Можно следующий слайд? Пожалуйста. Извините, я забыл «пожалуйста» сказать. Вот. Что мы видим на этой фотографии? Мы видим работу проектировщиков, специалистов, дипломированных специалистов, которые знают, как надо строить, как надо прокладывать тротуары. Вот только проблема в том, что люди не всегда действуют так, как должно, от них требуется ходить. И они ходят не там, где проложены тротуары, понимаете? Вот в чем как бы заковыка. Таких фотографий, если вы просто загуглите и посмотрите, да, тротуар, тропинка, просто 2 слова загуглите, выйдет полно таких фотографий. И это на самом деле происходит постоянно. Потому что люди не хотят ходить так, как вот прямыми углами поворачивать, они протаптывают тропинки. На самом деле на Западе уже есть такая практика, когда тротуар изначально не укладывается. Построен новый район, но тротуаров пока нет. Людям дают возможность протоптать эти тропинки, а потом там, где протоптали тропинки, прокладывается дорога. Вот почему нужно слушать людей. Вот и все, понимаете? То есть если мы будем дальше пытаться, считая, что мы имеем всю необходимую квалификацию для того, чтобы решать, как людям что-то нужно делать, то в этом случае мы будем делать не то, что будут потом не тем путем идти, по которым идут люди. И я, наверное, приведу в пример такую важную штуку, которая нас должна была доставить прямым рейсом к ликвидации туберкулеза, это ДОТС. Вот ДОТС был разработан специалистами. ДОТС это было прям, мы его считали же спасением. Но что получается? Недавно несколько лет назад, наша организация провела при поддержке партнеров, в том числе Европейской коалиции, Европейского бюро ВОЗ, мы провели небольшой опрос. Буквально 12 человек опросили из разных стран нашего региона. Оказалось, это люди были, которые принимали лечение. Оказалось, что из 12 человек, 11 человек, которые должны были каждый день ходить и получать лечение, они брали лечение на неделю вперед, на 10 дней вперед. Один человек сказал, что получил лечение на 3 месяца вперед. Это было буквально несколько лет назад. Мы это исследование закончили в 2018 году. В 2017-2018 году проводился этот опрос. Я сам, когда лечился от туберкулеза, извините, но я тоже не ходил каждый день за таблетками. Я сказал своему врачу, что, знаете, я человек, живущий с ВИЧ. Я принимаю антиретровирусную терапию, и мне ее в центре СПИД дают на месяц. И я ее пью, знаете почему? Потому что я хочу жить, потому что я хочу, как написано в Священных Писаниях, плодиться и размножаться, а для этого мне нужно принимать антиретровирусную терапию. Поэтому, пожалуйста, дайте мне лекарство на неделю, честное, пионерское, я приду через неделю за следующей партией. И я исправно пил. эти препараты. Знаете, в чем была проблема? Да? То, что на самом деле таких, как я, и таких, как эти 11 человек, достаточно много. Людям неудобно каждый день ходить и принимать препараты. Я не говорю, что этот подход нужно убрать на корню. Нет. Потому что один человек из этих 12 сказал, она сказала, я хочу каждый день ходить в диспансер, получать препараты, разговаривать с врачом, потому что у меня бывают побочки, мне нужна поддержка, я этого хочу. Поэтому я не говорю, что надо это убрать. Я просто говорю о том, что один этот подход, он не подходит для всех. И это была проблема этого ДОЦ. Еще одна проблема этого ДОЦ заключалась в том, и мы это удостоверились буквально в этом году, провели еще один небольшой опрос онлайн. В 2 регионах мира люди получают препараты 6 дней в неделю. Рекомендации ВОЗ говорят о том, что перерывов не должно быть. Протокол лечения нигде не говорит о том, что в воскресенье туберкулез совершенно спокойно лечится без препаратов. Нет. Если диспансер не работает, это еще не значит, то, что человеку не нужно принимать лечение. У меня туберкулез был 2 раза. Первый раз я лечил, как мне говорили врачи. Второй раз я докупал, слава богу, в аптеках у нас первая линия препаратов есть. Я ходил, покупал, и в воскресенье я кушал свои собственные таблетки. Слава богу, 10 лет спустя туберкулез не вернулся. Ну и более того, я с ним сейчас борюсь еще активно. Если можно, следующую фотографию. Так вот, знаете, да, этот корабль? Это «Титаник». Вот «Титаник» — это тот самый ДОЦ, который нас должен был доставить к ликвидации туберкулеза. Чем все закончилось, мы знаем. Все было ведь там здорово, да, на этом «Титанике». Ну, кроме того, что были кое-какие просчеты. Вот. И сейчас мы видим, что начало что-то меняться. Нет больше вот этого наблюдаемого, да, лечения под непосредственным наблюдением. Оно теперь лечение поддерживаемое. Да, мы поменяли название. Можно следующую фотографию, пожалуйста? Пожалуйста, я сказал, пожалуйста. Вот. Кто знает, что это за самолет? Ан-2. Еще варианты есть какие-то? Ан-2, кукурузник, да? Это Ан-2, и это не Ан-2. Это самолет Юн-5, китайский самолет, клон Ан-2. Он называется по-другому, фактически это Ан-2. Это Ан-2 и не Ан-2. Мы переименовали ДОЦ, мы назвали его поддерживаемым лечением, а не лечением под непосредственным наблюдением. Цель одна и та же – смотреть, следить за тем, чтобы человек принял вот эти таблетки. Если мы хотим, на самом деле, чтобы человека поддержать, то для этого не обязательно каждый день убеждаться, что он принял таблетки и говорить, что мы его поддерживаем. Поддержка заключается в другом. Я, наверное, закончу своей просьбой, наверное, к вам и предложением. Знаете, есть такая книга, ее написал американский предприниматель Эрик Рис. Она называется, ее неправильно перевели, на английском она называется Lean Startup. Ее перевели как «бизнес с нуля». Это не про бизнес. Это стартап. Эрик Рис дает такое определение стартапу. Это институт, цель которого создание нового продукта или услуги в условиях высокой неопределенности. Так вот, на самом деле, наша попытка покончить с туберкулезом к 30 году – это хороший стартап. Но для того, чтобы справиться с этим, чтобы наш стартап не обанкротился, и чтобы мы в 30-м году не сказали, ну, извините, мы сделали все, что могли. Вот для того, чтобы этого не произошло, нам надо поменять свои подходы. Я думаю, что если хотя бы часть из вас прочитает эту книгу и поймет, что на самом деле можно делать немножко все по-другому, что не обязательно разрабатывать «Титаник», который не доплывет, для этого можно и нужно поменять подходы. И самое главное, принцип, который заложен в этом подходе Lean Startup или бережливый стартап, как его переводят, он заключается в том, что надо все-таки постоянно коммуницировать с потенциальными клиентами, с потенциальными покупателями, с потенциальными пользователями, то есть людьми, пациентами, называйте их как хотите. Можно даже кейсами, хотя меня передергивает, когда я слышу, как людей называют кейсами или случаями. Спасибо огромное.
Thank you, Timur, so much. Thank you. So we are about to finish exactly 40 minutes for the session. Thanks, appreciate very much. Awesome panel. Few messages. We have barriers outside. We need to address the barriers. We need to talk to people to understand their needs. We need to address their needs. And we need to engage TB-affected community and civil society in our work. Only doing that, we will end TB by 2030. This is the conclusion of the session. Thank you so much. And I will give back to Monica and Sarah for next session. Thank you.
Thanks so much, VRL. Great session. Also to all the panelists, much appreciated. So now we continue with this session. We'll go ahead to the next presentation, and I'm very pleased to introduce Dr. Sayohat Hasanova from WHO Euro, and she will present on the multi-sectoral accountability framework on TB and perspectives, especially linking to the region. Over to you, Sayohat.
Thank you, Monica. Good afternoon, dear colleagues, dear friends. For English-speaking colleagues, please put on your headsets because I will switch to Russian with your permission. Здравствуйте, уважаемые коллеги, дорогие друзья. Я очень рада видеть вас. Сегодня последний день совещания нашего очень плодотворного. И меня попросили, мы отстаем чуть-чуть по программе. Я, наверное, с 15 минут перейду на 10 минут с вашего разрешения. И это, в принципе, не так сложно, потому что до меня уже задали тон. Мне уже не нужно объяснять, зачем необходимо вовлечение других секторов в борьбе, в ликвидации с туберкулезом, зачем необходимо привлекать организации гражданского общества и сообщества, затронутые туберкулезом. Я хочу обратить ваше внимание на механизм многосекторальной подотчетности для ускорения прогресса в ликвидации туберкулеза. Коротко мы его на русском называем ММП-ТБ, на английском МАФ-ТБ, наверное, вы все уже слышали, и на операционализацию его в нашем регионе. Это инструмент, который был разработан Всемирной организацией здравоохранения. Так идет синхронно, да? Немножко про предпосылки. Идея создания и разработки этого механизма впервые была заложена во время первой глобальной министерской конференции ВОЗ в 2017 году в ноябре, где принялась по результатам данного совещания политическая декларация, где все государства-члены обязались оказать поддержку в разработке данного механизма, и было обращение и просьба к ВОЗ создать такой механизм. И через год, во время первого совещания высокого уровня Генеральной Ассамблеи ООН по ликвидации туберкулеза в сентябре 2018 года, все государства-члены, они обязались развить это многосекторальное сотрудничество и подотчетность, и обратились к генеральному директору ВОЗ с просьбой, чтобы оказать техническую помощь в своевременном внедрении этого механизма. С тех пор, значит, в ответ на эти просьбы ВОЗ разработал данный механизм, и в мае 2019 года он обнародовал данный механизм, и с тех пор Всемирная организация здравоохранения, как вы знаете, оказывает техническую поддержку, осуществляет координацию, руководство государствам-членам и всем заинтересованным сторонам, всем партнерам в процессе адаптации и реализации данного механизма, а также проводит мониторинг и обзор внедрения данного механизма на 3 уровнях: на глобальном, на региональном и на страновом уровне. Что из себя представляет данный инструмент? Вы здесь видите непосредственно сам документ Multi-Sectoral Accountability Framework. Он разработан в соответствии со стратегией по ликвидации туберкулеза и с повесткой дня в области устойчивого развития на период до 2030 года. И, как я уже упомянула, оно, значит, разработано с целью того, чтобы поддержать и развивать эффективное сотрудничество между секторами, и как внутри сектора здравоохранения, так и за пределами сектора здравоохранения с другими партнерами, включая, значит, организации гражданского общества, включая сообщества, затронутые туберкулезом. Второй целью является укрепление подотчетности всех секторов по ликвидации туберкулеза. И также данный инструмент, оно помогает определить, мониторировать, значит, внедрение и прогресс достижения глобальных целей и показателей. И оно состоит из, как вы видите, 4 основных компонентов. Это обязательства, действия, мониторинг, отчетность и обзор. Наверное, я не буду останавливаться на этом. Я здесь доступна и дам свои контакты. Вы, если вас интересует больше, из чего состоят эти компоненты, я с удовольствием отвечу на этот вопрос. Еще хочу отметить, что ВОЗ также разработал вот этот инструмент для оценки, исходной оценки ситуации по многосекторальному сотрудничеству и многосекторальным ответным мерам на национальном уровне. Здесь, прежде чем я скажу, что мы делаем в нашем регионе европейском, я буквально коротко остановлюсь, что делается на глобальном уровне в помощь странам. На глобальном уровне в настоящее время завершается разработка 2 документов. Это оперативные руководящие принципы по адаптации и реализации механизма многосекторальной подотчетности. Оно содержит в себе оперативные руководящие принципы и советы по тому, как страны могут адаптировать и реализовать этот механизм. Второй немаловажный документ – это передовая практика, свод передовых практик в области адаптации и реализации данного механизма. Оно содержит извлеченные уроки и передовые практики, которые уже внедряются по укреплению многосекторальной координации и подотчетности другими странами, либо полностью это внедряется, либо какие-то компоненты, и в этом документе будут вот эти сбор вот этих передовых практик. Также в сотрудничестве с другими партнерами, такими как Глобальный фонд партнерства «Остановить туберкулез», Всемирная организация здравоохранения проводит мероприятия по укреплению потенциала на национальном уровне с тем, чтобы адаптировать и реализовать данный документ. Для координации на глобальном уровне с партнерами создана целевая группа ВОЗ. Вы здесь видите, из каких партнеров оно состоит. И также для предоставления информации и для обмена информацией между странами о том, как страны адаптируют и внедряют данный механизм, разработана виртуальная сеть по данному механизму, и здесь вы можете посмотреть ссылку на эту сеть. И также, как я уже сказала, Всемирная организация здравоохранения проводит мониторинг реализации данного механизма через сбор данных, ежегодный сбор данных по основным индикаторам механизма многосекторальной подотчетности, которые публикуются в глобальном отчете ежегодно. Теперь давайте остановимся, что мы делаем в европейском регионе. Чтобы начать операционализацию или адаптацию и внедрение у нас в регионе, мы начали с проведения консультаций с основными партнерами, глобальными и региональными партнерами, с тем, чтобы иметь общее видение и общие подходы к тому, как адаптировать и внедрять этот механизм в нашем регионе. И по результатам результаты этой консультации были проанализированы, и мы их задокументировали, имеются рекомендации, и на основе, значит, этой консультации мы разработали региональную концепцию с указанием тех основных мероприятий, которые странам необходимо внедрять для адаптации и запуска механизма многосекторальной координации. И мы пилотируем этот подход в 5 странах, и эти страны сидят сегодня здесь. Это Республика Беларусь, Республика Молдова, Таджикистан, Казахстан и Украина. И данное пилотирование мы проводим совместно с партнерами. Это партнерство Европейская коалиция борьбы с туберкулезом, и, пользуясь случаем, я хочу их поблагодарить, и сеть Global TB Caucus. Также мы адаптировали контрольный список к нашему региону, контрольный список по оценке исходной ситуации, и помогаем странам в проведении этой оценки. Следующее, что делается на национальном уровне. Да? Мы продолжаем оказывать стратегическую и техническую помощь странам в ходе разработки их национального видения или дорожной карты с описанием путей укрепления многосекторального сотрудничества и отчетности. Мы также предоставляем стратегическую поддержку и техническую помощь в определении состава, ролей и обязанностей национальных органов по многосекторальной координации и также механизма обзора на высоком уровне. Также мы предоставляем техническую помощь в включении данного механизма в национальные стратегические планы и также в заявке по финансированию заявки доноров. И сегодня уже Пол отметил, что мы совместно с нашим региональным коллаборативным центром создали реестр консультантов из числа гражданского общества и сообществ, затронутых туберкулезом, для того, чтобы они участвовали в мониторинге и в проведении обзора национальных туберкулезных программ. И у нас в регионе, как вы знаете, представители гражданского общества и сообществ, затронутых туберкулезом, участвуют в проведении национальных обзоров туберкулезных программ. Здесь вы видите 4 основные действия, которые мы предложили для наших пилотных стран для адаптации и запуска механизма многосекторальной координации. Туда входит инициация, первый этап, проведение национальных консультаций и для запуска данного механизма, проведение исходной оценки, чтобы определить, на каком этапе находится страна, с последующим использованием этих данных для разработки национального видения или дорожных карт, или стратегического видения, как укрепить межсекторальное сотрудничество и как укрепить подотчетность. И потом последнее, это и немаловажное, помощь странам для создания органа многосекторальной координации и подотчетности и механизма обзора на высоком уровне. Здесь вы видите статус реализации у нас в 5 пилотных районах, в 5 пилотных странах, Во всех странах уже определены местные координаторы, которые координируют процесс инициации и запуска данного механизма, включая проведение национальных консультаций и проведение исходной оценки. Эти все мероприятия проведены во всех 5 странах, и по результатам оценки страны находятся на разных этапах определения дорожной карты, своего видения, как укрепить этот механизм. Например, в Украине это уже документ разработан и одобрен. В процессе согласования с другими секторами находится Республика Беларусь, Республика Молдова и Казахстан разработаны проекты, и они находятся на согласовании с национальными противотуберкулезными программами и с министерствами здравоохранения. А в Таджикистане проведение и написание данной дорожной карты, оно запланировано в национальном стратегическом плане. Все страны имеют орган многосекторальной координации, но, к сожалению, эти органы, они не во всех странах, как сегодня в Таджикистане сказали, что он на очень высоком уровне, во всех странах он создан на высоком уровне, чтобы обеспечить не только координацию, но подотчетность других секторов. То есть этот орган должен быть создан на таком высоком уровне, чтобы обеспечивать эту подотчетность не только Министерства здравоохранения и сектора здравоохранения, но других секторов, а также других партнеров. И механизм обзора высокого уровня. Во всех странах есть механизм обзора, но оно не на таком высоком уровне, чтобы, опять-таки скажу, обеспечить подотчетность. То есть у нас в регионе, в принципе, В целом идет хорошая координация, вот здесь я сейчас в слайде покажу, но у нас отсутствует компоненты подотчетности, которые нужно укреплять. Здесь вы видите тенденцию в реализации основных элементов многосекторальной подотчетности, но мы акцентируем ваше внимание здесь на 18 высокоприоритетных стран в европейском регионе. И вот вы видите кружки, да, вот красные, вот эти страны, 18 стран высокоприоритетных с точки зрения ликвидации туберкулеза. И как вы видите, в период с 2020 по 2022 года идет улучшение. Вот первый индикатор говорит о том, что в скольких странах имеется механизм координации и подотчетности, и также механизм обзора высокого уровня. Как вы видите, на состояние 2022 год 89% стран с высокоприоритетных по отношению к туберкулезу имеется это механизмы, но опять-таки я говорю, что он не на таком достаточно высоком уровне, чтобы обеспечить подотчетность. Второй, значит, индикатор вы здесь видите, это наличие ежегодных национальных докладов или отчетов по туберкулезу и насколько они доступны для широкой общественности, так скажем. Да? Опять-таки вы видите, 83% стран имеют данную отчетность ежегодную, но вот у нас был разговор с заместителем министров, что все равно нет отчетности других секторов и других партнеров. Это в основном отчетность включает отчетность сектора здравоохранения, поэтому необходимо работать в этом направлении. И следующий индикатор – это значимое вовлечение гражданского общества. И сегодня вы убедились, что, в принципе, у нас в регионе эта работа идет хорошо. И 67% стран у нас в регионе гражданское общество и сообщества, затронутые туберкулезом, активно вовлечены в процесс внедрения, в процесс ликвидации туберкулеза. И, подводя итоги, я хочу акцентировать наше внимание на то, что прогресс достижения наших амбициозных целевых ориентиров стратегии ликвидировать туберкулез невозможен только за счет усилий системы здравоохранения. Он требует твердой политической приверженности на самом высоком уровне, сильного многосекторального сотрудничества и эффективной системы подотчетности. И для этого инструмент, который разработал ВОЗ, инструмент по многосекторальному механизму подотчетности, оно является действенным инструментом в поддержку эффективного сотрудничества как внутри сектора здравоохранения, так и за пределами здравоохранения, и также он обеспечивает подотчетность, как уже мы сказали. Поэтому вывод и основное послание вам, уважаемые коллеги, необходимо в нашем регионе расширить масштабы реализации этого механизма, тем более мы находимся в преддверии совещания высокого уровня 2023 года, и кофасилитатором этого совещания в этом году являются 2 страны с европейского региона. Поэтому мы должны показать на своем примере нашу приверженность на высоком уровне. И для ускорения национальных ответных мер необходимо создать и укрепить национальные многосекторальные органы по координации и подотчетности и механизмы обзора на высоком уровне. И национальные механизмы по подотчетности и координации, они должны быть приведены в соответствии с национальными стратегическими документами и с системами мониторинга и отчетности. Это был мой последний слайд. Благодарю вас за внимание. И, пожалуйста, подходите ко мне, если будут вопросы, потому что у нас сейчас не будет времени для вопросов-ответов во время кофе-брейка или обеда. Или здесь вы видите мои контакты. Пожалуйста, напишите, мы с удовольствием поможем вам. И, пользуясь случаем, я бы хотела поблагодарить всех наших коллег, наших партнеров, которые оказывают нам помощь в реализации данного механизма. Спасибо.
Thank you, Sayohat, for an excellent presentation. It's indeed multi-sectoral engagement and accountability is indeed very important, and it's been, I think, listening over these days to the countries, this region is really ahead of other regions in terms of implementation of the multi-sectoral accountability framework, in terms of engagement with other sectors and core examples. So Yeah, thank you, Sayuhat, for sharing, and we'll look to any questions that you may have through the day. Please do feel free to post them on Slido. So now I know we have a lunch coming up, but we ask for your patience for another 20 minutes or so. We'd like to continue a little longer and then break for lunch. So with that, as we come to this final part of the session, I'd like to thank Sarah, who was the co-chair, and invite, of course, Stella Bivol, who you know well from WHO Euro, to co-facilitate this last session with this last part of the session with me. So maybe we'd like to start with hearing your perspectives. And so if I can ask Andre to put up Slido, if we can ask colleagues to go on www.slido.com. If you are not already signed up, or there must be a QR code, it'll come on the screen. So we want to keep this last session as interactive as possible. So, okay, there you go. So you can join at www.slido.com. The password is #21112022, or use your camera to scan the QR code. So please join us, and then maybe we can open it up to the first poll. All right, so we want to hear from you on what the top 5 areas are. So it's a ranking poll, so you need to pick the top 5 areas where you still need external partner and donor support to reach the NTB strategy targets. And here you can see, so it's both in, okay, so it's been translated in English and Russian. Stella, would you like to add it?
So unfortunately, we are not seeing it right in front of us, but you have a list of questions or program areas from which to pick. And you have to pick 5 areas where your country still needs external partner and donor support to reach NTB targets. And these are people at the center, TB prevention, systematic screening, TB diagnosis, going down, TB treatment, health finance, governance and leadership, health workforce. Okay.
We've got
Going down.
12 only. Please be more active. 14.
Yes.
Yeah,
Уважаемые участники, заходите, пожалуйста, на Slido, используйте свои телефоны и выберите 5 приоритетных направлений, где вам еще нужна донорская поддержка для того, чтобы добиться результатов. Вы помните, в первый день у нас хорошо получилось использовать QR-код, да? Это вас приведет к этому вопросу, и мы ждем вашего активного участия. Пока что у нас 26. Заходите.
Okay, so we can see the ranking coming up. We see TB prevention.
You have the QR code on the back of your tag. If you look at your tag, you have the QR code on the back, and you go to Slido, and it will take you here.
Yes, really simple. Please do mark. It's good to see 37 people online. And yeah, so this is going to be important for this part of the session where we're discussing the road to success and key asks. So we really want to base our discussions around your input. So we'd like you to be engaged. So while we'll give you maybe 2 more minutes, I can see that the numbers are going up. Why don't we call the panelists on stage? So we'd like to invite Viorel from Stop TB, Dumitru from Global Fund, Erica from USAID, Marika from ECDC. So if you could please come on stage and take your seats while we encourage participants to rank on Slido. Okay, so we have crossed 50. So we are at 50 people registered. This is great. And so we can see very clearly from the region that you're ranking TB prevention at number 1, people at the center, as we've heard from many of you, as the second priority where you need support, systematic screening, health finance and UHC, and strategic information and digital health. So it looks like these are the top 5 areas where you countries are clearly asking for support. So this is good to continue our discussions with our panelists. So let's now move to the next poll. We have one more quick poll. So if we can move to the next one. So we've noted these 5. So we'd like to hear from you now. Yeah, and let's just mix the two. So what support do you need from WHO and partners for the year ahead to accelerate the TB response? And here again, looking specifically in terms of preparation for the 2023 UN high-level meeting. So here you can see there's quite a lot. Wow, technical support, everyone's clicked on that, brilliant. Okay, so then there's high-level political dialogue, community-based delivery, advocacy and communications, procurement of commodities. Okay, so people are now logging into this poll. So we'd like to hear from you. So in the earlier one where you asked about support, it was clear it was, yeah, TB prevention, systematic screening, patient-centered care were the top 3. Now looking ahead to the UN high-level meeting and also building on the dialogue that we had with Deputy Ministers of Health and the Member of Parliament, it's clear that yeah, political dialogue is going to be really important as we look at preparations for the high-level meeting, given that you're going to have heads of state report back on progress. And of course, there's technical support, advocacy and communications, and support to community-based delivery. So we have 34 people registered, and we can see that these are the top 4 in the entire list. And then comes procurement of commodities. Okay, so we'll keep this poll open, and then we'll look to hear from you on your key asks, because this is going to be the focus of our panel discussion just now. So without further ado, let's now go to the discussion with partners. We are very pleased to have with us all the core partners looking ahead for the year ahead, specifically to the UN high-level meeting, and also looking ahead as we're all looking to get back on track for the TB response. So let's turn first to Stop TB. We have with us Viorel Sultan, Head of Country and Community Support for Impact. So VRL, over to you on what you see, quick 3 to 4 minute intervention on Stop TB's role in terms of responding to these key asks and what the vision is looking ahead.
Thank you. I appreciate Monica. Couple of things. It's a very important year, as I started in the first day, as you remember, to discuss our agenda going further. It is very important to look critically at our national strategic plans. We started here to align the action plan with our strategic plans, and this is very important in line with the Global Fund replenishment, right? So that's one step that needs a lot of technical support. And I guess you will hear from all my colleagues here in the panel that all technical partners are happy to do that. From the Stop TB partnership, of course, we are happy to mobilize all our support in terms of engaging into all these processes, starting from the NFM for development, bringing civil society on the table, engaging TB-affected community. We, you know that we have a specific grant-making mechanism in Stop TB partnership called challenge facility for civil society. And right now, we deployed more than 160 grants in 35 countries around the world. From our region, all Central Asia countries, plus Ukraine, are beneficiary of those grants. So please use those grants for engagement, and we are happy to support that. Also, on top of this, there are several roster of consultants that we are happy to deploy those to meet your needs. And your needs are already discussed by you in the working groups during all these days in terms of aligning the NSPs to the regional action plan. So I guess I will stop here and will jump on further discussions because there are a lot to share with you. Thank you. Back to you, Monica.
Thank you, Buriel, for these important points. I'd like to now move to a question towards to my left-hand side, to Global Fund, and to Dumitru Latvichevsky, the regional manager of the ICA team. We are in a year of challenges. We heard there's many more challenges ahead. At the same time, while the replenishment was successful, there will be more fiscal pressures on both the donors and the countries. So we heard a very strong call to do more with less. So in this more challenging environment, what is the formula for success from your perspective, from the Global Fund, and what are your key asks to the countries in preparing for the next funding cycle?
Maybe I could then answer with a question. What's wrong in my motto? The Global Fund wants efficiency, efficiency, efficiency. Yeah, the mistake is that it's inefficient to say efficiency 3 times. We just want efficiency. And to be serious, what we are looking at is doing a lot more with somewhat less. And this is because the region was so successful in conventional TB, the trends are so good that by every measurement, the needs in the countries appear to be smaller than they were in the last allocation cycle. So in that sense, we will definitely have to find ways of achieving more with relatively small allocations. And luckily, and Luchika pointed to it in the content of this meeting, luckily, there are interventions which bring faster results, quicker and better treatment, faster and at better costs. So in that we are completely aligned with the action plan. Our own ICA priorities are very much in line with that. So we should be able to be efficient in the next 3 years.
Thank you, Dumitru. No, Monica.
Okay, so now we turn to USAID. So it's great to hear from Global Fund, our largest international donor. We now move to the largest bilateral donor and partner that we have, the US Agency for International Development. I'm very pleased to invite Erica Vitek, who is the MDR TB advisor from USAID, to share your perspectives on support to countries in these key asks, especially looking ahead to get back on track in the TB response. Over to you, Erica.
Thank you very much. Thank you for inviting me to participate in this panel, which really gets into the important question: what do the European region countries need to do to reach our targets, especially in the light of gaps induced by the COVID pandemic? Earlier this week on Monday, my colleague Sevim Amidov, he introduced our new TB new global TB strategy, which is organized around reach, cure, and prevent. And it has some new elements of innovate and sustain. I will go by each element of that strategy and provide my provision, what needs to be done under each of the objectives. So the strategy is based on providing a high-quality technical assistance and implemented in the partnership with the affected individuals and communities. We know that we have some progress, but we're still far away from reaching the progress goal. And in order to reach those goals, we need to redouble our work with the affected communities and the governments to help create that space for patient advocacy and community engagement. If you look at the reach, where our goal is 90% of the incident TB cases diagnosed and put on treatment, and the similar goal is for the drug-resistant TB. Making progress here will require more effective diagnosis and linkage to care. We know that the TB incidents decreased due to the COVID effect. So in order to find more cases, we need to probably initiate active case funding in selected population. Introduction of the digital health and new technologies for the case funding also will help to find the more people. We need innovations and we need new tools. Increased engagement of the primary care sector for diagnosis of patients with clinical symptoms continues to be strengthened. And also improving linkage to initiate treatment will require working with the clinical system and through community-based approaches, so we ensure that the patient won't fall between cracks after they diagnose and put on the treatment. So regarding cure goals, which is 90% of success rate for both types of TB, we have some improvement, but we're still short of the mark. So what we need to do here in order to come to our goals? We need timely initiate the treatment. We need to expand access to new drugs and regimens for the treatment of the resistant type of TB. We need to provide better support for the patient with the drug-susceptible, drug-resistant TB. We need to introduce alternative models for the care delivery. And in the previous session, it was said that it should be patient-oriented, what convenience for people and how the people can get the treatment. We need to introduce the digital health technologies to improve the treatment adherence. And it was said by Askar that the treatment should be effective, short, safe, and affordable. Regarding the prevent goal, where we need to here the considerable efforts will be needed to increase TB enrollment, in particular among the adults case close contacts. That could be the household or the close contacts of individuals with bacteriologically confirmed pulmonary TB, and individuals with the high burden in the high burden countries at elevated risk due to the medical or other conditions that weaken immunity. We also need to increase TPT enrollment for children, and we need to have access to new and more accurate tools for identify TB infection and for new regimens for TB preventive therapy. In conclusion, I would like to thank you all for what you've done, what you're doing, and will continue to do. And from our side, I can assure you that we'll continue to provide the technical assistance to all countries that we're working with. Thank you.
Thank you, Erika. Now a question to our partner on the western side of WHO European office, European region. Let me introduce Marek van der Werf, the head of disease program at the ECDC. For the last 4 days, you have seen the priorities for high burden and TB countries, which are more or less, on the eastern side of the region. So with the perspective of the EU, what do you see are the key, bottlenecks to success, and also what are the key priorities for the Western side to get closer to TB elimination? Thank you.
Thanks, Stella. Just to paint the picture of the situation in the EU, that we in the EU we've seen a decline in TB notification of about 5% for many, many, many years. And in 2020, we were at 7.3 per 100,000. So that's below the 10 per 100,000 or the 100 per million target. We have, however, a few countries with a higher notification rate, and I'm very happy that those are also here in the room participating in this meeting. If we look at drug-resistant TB, then the situation is also different in the EU compared to the countries in the other part of the WHO European region, with most countries having really much less than 5% of their TB cases having RR or MDR TB. So looking at this, I think we can conclude that overall, the situation in the EU looks better than in the other part of the WHO European region. But that comes at a price, because what we struggle with in the EU and EEA is that TB is absolutely not a priority. And another thing related to that is that in the clinical world, the knowledge and the expertise for diagnosing and treating TB is reducing quickly. So those are two specific challenges for the European Union. What I think the European Union countries should focus on, and what ECDC will support them in, is, and I'm going to mention two things only, is first of all, focus on risk groups. Because if your epidemic goes down, you find much more cases in specific risk groups. And one specific risk group for the EU is migrants, but there are others, of course. We also have homeless with TB, we have alcoholics, or people who use too much alcohol, actually drug users, and so on. So there will be a focus on risk groups. First of all, for that you need to know who your risk groups are, and that's different in different member states. So there needs to be either from surveillance data or from specific studies knowledge about what the risk groups are. These risk groups need to be screened for TB disease or tested for TB infection if the estimated incidence in these groups is really high. We would also advocate for integrated testing, meaning also if you test for TB, then also consider whether you need to test for HIV or for hepatitis C, because these diseases often aggregate in the same risk groups. If you do that, then please monitor what you're doing and adjust your program if you see that you need to do more or you could do less. And I'll just finish this part with mentioning that we need to work with all the relevant sectors here, including civil society, because it's not easy to first identify the risk groups, then get them involved and get them tested or screened, get them adhered to the treatment if they need treatment, and finish it successfully. The second item I want to mention is that we need to work in the EU at reducing the pool of people infected with TB. So we need to scale up TB preventive treatment. And for that, well, there are really good recommendations for that. We have shorter regimens now for TB preventive treatment. What I think we still need is a better test, actually. So maybe that can be included in the research efforts. But we need to test those groups that have high prevalence, or where we expect a high prevalence of TB infection, and then if needed, we need to provide them with TB preventive treatment. And also here, it's basically the same. We need to monitor the implementation of TB preventive treatment, see whether people really get it if they need it, and finish it. And also here, of course, there's a role for many sectors, prison sectors, but also civil society, patient organizations to get this done. So this will be the focus of ECDC in the coming years. We will work with you, and we hope you will work with us as well, so that we can get to, first of all, ending TB and then TB elimination. Thank you.
Thank you very much, Marika, for that comprehensive response, both looking at ending TB and the elimination, indeed important perspectives for this region. So pleased to go now to the last panelist. We have, you know very well, Dr. Askar Yadilbayev, TB Regional Advisor from WHO Euro. So Askar, we've heard back from countries and also looking ahead, what are the key asks from the WHO, WHO perspective across all three levels, two countries looking ahead to get back on track towards ending TB. Over to you, Askar.
Thank you, Monica, and thank you, dear panelists. So on behalf of our team in the WHO Regional Office for Europe, but also the WHO colleagues in the country offices, I would like to say that most of the key asks have been articulated during these 3.5 days already. So thank you for being vocal. Thank you for articulating. Thank you for bringing up on top of the agenda all issues that are burning, that require technical support. This has all been recorded, and this has all have been noted and will taken into action. Because what we think after the development of the Regional Tuberculosis Action Plan, that everything that is highlighted there is correct in terms of supporting you in setting up the trajectory on ending tuberculosis by 2030. Yet we have these ambitious milestones by 2025, and this meeting was exactly about that, of what should be done until the 2025 jointly to achieve these ambitious targets and significantly decrease the burden of TB, even that soon. So I would like to say that definitely the key asks from the WHO would be that we will be happy to provide the technical support. And there was a request on providing technical support on tuberculosis prevention, screening, tuberculosis diagnosis, treatment and care on all the technical areas, and also introduction of research and innovations. But at the same time, we would like to kindly ask to make to establish the enabling and convenient environment for the uptake of these latest guidelines in terms of the environment and the processes of adopting the new guidelines, the new protocols faster than removing the barriers that can exist at the country level. So this will definitely facilitate and foster the uptake of the latest guidelines and recommendations. I would like to know that the WHO is developing guidelines that are based on the evidence, and that is going through the very, I would say, comprehensive and thorough revision by the guideline developing group. So, and the WHO is having an intention to share the recommendations on the based available evidence as fast as possible that will make a greater impact in the countries on this area. So we would also like to ask, besides establishing the convenient environment for the uptake of the recommendations, is to increase your support, financial support to the National Tuberculosis Program, to your health systems involved in the tuberculosis response in order to support the implementation, in order to support the uptake of the innovations and the benefits from the research that we are supporting. So we all know that countries are recovering from the COVID-19 pandemic. A lot of resources have been focused on that, but now we hope that we are at I would say, the final stages of the pandemic, and we need to by addressing the pandemic, also not forget about the existing problems and challenges that we have, like communicable diseases. And this is the dual track approach, and this is the dual track approach that was described in the welcoming speech by our regional director, Dr. Hans Kluge. And the last but not least, I would like to say that we are asking you to ensure that there is a multi-sectoral accountability and multi-sectoral engagement, because in partnership with involving everyone, especially including the civil society and affected communities, as my colleague Marika just mentioned, is so much important. And because they're the key instrumental partners on this process, because without them, without their support, achieving these ambitious milestones will not be possible. So again, an ask for the governments, and for the ministries of health to consider at least the social contracting for the NGOs, for the civil society organizations, for them to enable their support to countries. Well, thank you.
Thank you very much for that comprehensive intervention, Askar. So as we come to the end of the session, we'd like to thank all of you in the audience for very interactively participating, for sharing your perspectives, your key asks. We've taken note of this, as also Askar has mentioned, and we look forward to continuing this discussion. And also, big thanks to our panelists from Stop TB Global Fund, USAID, ECDC, and of course, our WHO colleagues here for joining this panel discussion. And now looking ahead now to a late lunch. So we'll move for lunch, and it's going to be a slightly shorter lunch, so ask for your indulgence. If we can be back by 2:10, please. So 40 minutes. Thank you very much for your understanding.
It's not easy for all of us, of course, because after so intensive discussion in the morning and so many emotions after presentation to Riza Kasaeva, other people, it was a reason for all of us to change view during lunchtime. But now we need to move forward because we very, very late on our schedule, and I have honor to present co-facilitator this last session of today, our colleague, Chief of Party, USAID Project Elimination TB in Central Asia countries, Honorable Dilarom Kasimova.
Thank you so much, Natalia Nikolaevna. It's my pleasure, and I have an honor to have such a great co-facilitator today with Professor Natalia Nikolaevna Nizova. She is the member of Technical Advisory Group for WHO Euro on TB. I'm really glad.
Thank you, Dilarom. And just now we have honor to invite for first presentation our colleague and friend from WHO Euro Office, Stella Bivol, with presentation overview, strategic presentation, spreading the implementation of TB-REP 2030, Pillar 2, bold policies and supportive systems, the more important strategic part of our program during these last 3 days. Vela, Stella, welcome.
Thank you so much, and good afternoon, colleagues, and thank you for those who came back on time. It has been indeed a very packed agenda for the last days, and as we get to the end of the meeting, keeping focus is a bit of a challenge, but I will try to be brief and succinct in going through sometimes very difficult concepts for a technical group to address. Nevertheless, without this, we cannot move forward on our ending TB goals. So for now, you know, we in the first 3 days, we covered Pillar 1 and Pillar 3, integrated people-centered care and intensified research and innovation. The focus of this session today is Pillar 2, bold policies and supportive systems, with a remark that people at the center, if you also remember, all the key elements of service delivery we have covered in day 1. So we will focus mostly on governance and leadership, health finance and universal health coverage, strategic information and digital health, health workforce and affordable access to commodities as they are relevant to European region. And when we talked about strategic shifts and operational shifts, we listed a number of them. And UHC PHC agenda, alignment with European program of work, renewing commitment, innovations, and catching up and building back better were the areas we have covered at length in the last 3 days. Today, we are focusing on disease responses that are nested in resilient health systems and successful transitions. But nevertheless, each of these elements that you see on the left-hand side actually have a lot to influence the other strategic shifts that we have discussed in so far. Now, when we talk about governance and leadership, Sayohat Hasanova has made a comprehensive overview of the importance of whole of government and whole of society approaches to end TB, and particularly on the importance of using multi-sectoral accountability framework for TB that are our vehicle to increase both commitment and accountability and measuring progress. At the same time, there were two elements that we have not covered that are included in the regional action plan in the first half of the day, which has to do with the governance and leadership of the national TB programs, as well as the place of the TB programs within the governance of the health system. And for this, we have a region that is highly heterogeneous where the TB programs are. In high TB burden countries, the TB programs are have a strong centralized coordination. In countries with low burden TB, the services are fully integrated in the general health services. So the solutions to strengthen and to continue to coordinate services will be very different in different contexts. So there's no one size fits all. And so each country will need to find its way to ensure that TB and strike a balance from full integration to full centralization, and these different ways of organizing services and governing this will be different for each country. So that's why it's important that each country finds its own solution on how to align to UHC framework, and also how to plan for service integration that are specific to the context of the country. That's why the regional action plan has these very high level priority areas and actions for which you will have to find your own specific solution and make your specific plans. It's intentionally very high level so that you have flexibility to do that within this component. Now, moving to health finance and universal health coverage. My colleague from Stop TB Partnership has covered quite comprehensively the universal health coverage and the cube that is a mix of the comprehensiveness of services, the costs that are incurred that they need to be fully covered, and the equity and key and vulnerable populations being the importance of prioritizing key and vulnerable populations to be covered. And the fact that TB is one of the tracer condition on the UHC means that we need to put more emphasis on how TB is included in the essential service packages, how it is integrated in the primary health care, and how we are making sure we are progressing to significantly reduce the catastrophic costs. A challenge for our region about catastrophic costs is that they have not been measured. Although we have a zero catastrophic cost goal, there's only one country that has measured the catastrophic costs as a baseline. And the other countries, although they have made efforts to measure the costs that are incurred by patients, they are not standardized or comparable across the countries. But what we have seen from the survey of the those countries that did look at the financial barriers, it shows that the costs are usually not non-medical. So the medical costs for patients are covered. The expenditures that are related to travel, to food, to a loss of income because of lack of unemployment are the ones that are more important than those that are medical. Coming back to this graph that you see, the gap between the funding required and the National Strategic Plan for TB and available funding. What countries report through the Global TB program, the Global TB reporting, shows that actually, and you can see in the red dotted circle, that traditionally Euro region was not a region that really had a major funding gap for tuberculosis programs. What we have seen in the last year, in 2020, was actually an increase in the funding gap, and that was due to the fact that the resources were detracted from the TB response and put into COVID more often. In this year, however, we see a return to the funding level from before. And so compared to other countries, we are okay. To other regions, I mean, we are more or less on the better off side. However, you know, when we had the first day on discussing what are your key needs, the Slido, you know, survey that we did, and Tawhid did for NSP, showed that actually the costing of our NSPs is not perfect. So oftentimes the costing that is used is not done in a way that covers all the needs. It's more to cover the health needs or more to cover the program needs traditionally, but it's really not covering fully the areas that are outside for high impact interventions that are now being covered by donors. So the quality of the data may be an issue. So in terms of health finance and UHC, we are having an increased funding gap. We still have financial barriers. We are also seeing a slow realignment of resources to evolving models of care. And we know that allocative efficiencies to match people-centered service is an area of challenges. So in terms of priority actions, the key priority actions for the member states are to mobilize resources for health, to provide adequate financing, to scale up domestic resources to get back on track. As Andrei Dadu showed on day one, we will need short-term higher investments in the next years so that in the midterm to long term, we start investing less. Ensuring financial access to services to all people, especially vulnerable groups and key populations. A specific challenge for the region is to aligning strategic purchasing of TB services and scaling up service packages for supportive services and clinical services, and public funding of supportive TB services through social contracting. And finally, to improve the quality of and availability of data on domestic investments into TB, because when we do analysis of the investments, we really don't have the granularity of data to understand what is actual expenditure in this area. Moving to health workforce, including community health workers. As we move towards people-centered model of care, one of the key areas where we need to invest more is to diversify the cadre of professionals, including non-health. We need social workers, we need psychologists, we need task shifting, and if we decentralize, we need more investment into health workforce. And with stronger role of primary care and community-based providers, this means challenges in terms of formalizing their roles, in terms of their training, and in terms of ensuring quality services. Another challenge is the evolving role of vertical specialization. As we have a reducing burden of tuberculosis, and we strive for integration. We have a challenge to have fewer people who are specialized on TB, and the challenge is to not train more verticalized TB specialists, but find ways how to merge specialties, how to integrate TB care into other services and into the curricula of other health workers. And finally, the health workforce challenge. We know the distribution. We need decentralized model of care, but our health workforce is not there. So we need to understand how to match where we need the services and where we have the health workforce. So the priority action for member states is to ensure task shifting across health workforce, to provide the right number of mix of health and non-health workers, to provide continuing professional development to the health workforce, to merge the TB specialties with the pulmonology or infectious disease specialty, and to provide adequate regulation, capacity building, and support for community-based members of the health workforce. Moving now to surveillance and strategic information. So overall, again, if we look at the globe, the region is quite good in terms of having case-based surveillance systems for TB. You see it's dark blue. Every country has started, almost all countries have started the case-based surveillance with a few exceptions, and you see some of the spots there of the exceptions of countries that don't have a case-based digital surveillance system for TB. But at the same time, we still have a few challenges in terms of what is this case-based surveillance system doing and what we need in terms of data analysis, in terms of data visualization, in terms of data disaggregation. As well, it's still a mix of a burden of reporting, both paper-based and electronic. And this puts more on the frontline workers, as well as fragmentation of data management systems and the importance of ensuring interoperability with other general electronic-based systems in the country. For digital health, we've already discussed a bit on the video-supported treatment, that this is a major development in the last years, as many of the countries have already invested and started implementation, even nationwide implementation of digital health solutions for ensuring digital adherence, either of customized or third-party platforms, and the coverage is increasing in terms of how many people have access to that. But this is not the only digital health solution that we need to focus on. We also have community-led monitoring that allows to ensure the quality of services are people-centered. And we heard from a previous panel the importance of hearing from patients what works and what doesn't work for them. But it's important also to have these community-led monitoring platforms routinely talking to the national electronic systems, not only through reports, but on a to provide these routine feedback mechanisms. So for strategic information and digital health, the priority actions would be to ensuring functioning of case-based data system for real-time data recording, reporting, and use for programmatic management and research, and continue to scale up the use of digital technologies throughout the TB care pathway. Finally, I will use a couple of slides from our Stop TB partnership colleagues that we heard 2 days in a row, to just understand what the TB world is going through in terms of the technological revolution. This is the number of products that have been made available for diagnostics. You see 2021, a very important year of starting innovations. Innovations are good, they are better, but they're also more expensive. So to ensure access to new technologies, it's great that we have GDF, but we need to also ensure that the countries that are not accessing GDF can access affordable health products and find solutions how to access GDF if that is the case, or make price reduction strategies to ensure access to those products. The similar situation is for supply of medicines, when since 2015, basically, we have all the newer drugs and also the newer formulations that are luckily available through this market shaping approach that is done by GDF, but it's not evenly distributed across the region. And countries on the West know what I'm talking about when the access to and transition to fully oral medicines is exactly impeded because of this lack of affordable access. We also have very good examples of transition of procurement of TB programs using state funds in ICA countries. Again, on the East, I'm sure there are many ways to ensure the same access on the West. So this is something that probably will be an important priority for all the countries to ensure successful transitions from the Global Fund, but also ensure successful transition in the government, fully government provided programs to newer technologies. So in terms of priority actions is to optimize the registration process. The priority actions are to optimize the registration process and improve affordability of new products through expanding price decreasing strategies and agile procurement mechanisms. Thank you for your attention.
Thank you very much, Stella. Thank you, Stella. Indeed, very interesting presentation. And we know that there was lots of information and so much, so less time we have for this. So the next session is we will hear the presentations from countries, and we would invite on the stage the representative of Uzbekistan, Dr. Hassan Safayev. He is Deputy Director of the Specialized Scientific Practical Medical Center of Physiology and Pulmonology of Republic of Uzbekistan. Please, Dr. Hassan, the stage is yours.
Dear colleagues, we will kindly ask you to look at the timeline, not more than 10 minutes, please.
Спасибо. Уважаемые коллеги, разрешите представить опыт Республики Узбекистан в государственных закупках противотуберкулезных препаратов. Начиная с 2001 года по 2006 года в Республике Узбекистан закуп противотуберкулезных препаратов первого ряда осуществлялся за счет гранта правительства Федеративной Республики Германии, а уже с 2007 года по 2020 года закуп всей потребности противотуберкулезных препаратов осуществлялся из средств гранта Глобального фонда. Кроме того, с 1998 года Международная организация «Врачи без границ» начала свою деятельность в Республике Каракалпакстан, которые тоже закупали препараты для борьбы с туберкулезом. В настоящее время в нашей республике используется весь перечень препаратов первого и второго ряда, который включает и взрослые, и детские дозировки. Кроме того, мы в этом году получили новую дозировку бедаквилина 20 мг и деламонида 25 мг. Этот перечень считается диспергируемые препараты, которые очень хорошо усваиваются больными туберкулезом детьми. И еще из новшеств мы уже используем комбинированную дозировку изониазида с рифампинцином, который называется HP, для лечения больных с латентной туберкулезной инфекцией. Переход на государственное финансирование начался с 2016 года в рамках договоренности между Глобальным фондом и Министерством здравоохранения, где было сказано, что государство перейдет на 100% закуп препаратов первого ряда и с ежегодным 20% приростом препаратов второго ряда. В связи с чем в декабре 2015 года было выделено $1 миллион на произведение закупа, но, к сожалению, это Сумма хватила всего лишь на 5% потребностей по препаратам второго ряда, и 100% мы охватили потребность в препаратах первого ряда. Но, к сожалению, в последующие 3 года у нас не было выделения финансирования из средств гранта государственного бюджета, а уже в 2019 году выходит постановление президента, в котором уже в дальнейшем прописывается, что будут на постоянной основе выделяться средства для закупа противотуберкулезных препаратов. И в 2020 году у нас идет, значит, 10% ежегодный рост, и в новой программе президента мы закладываем средства на следующие 4 года, которые будут покрывать 100% потребность препаратов первого ряда и 50% половину препаратов второго ряда. Что касается по распределению финансирования, у нас таргеты по выявлению лекарственно-устойчивого туберкулеза более 3000 больных в год. И если вы обратите внимание, это, например, в 2021 году было по плану выявить и начать лечение 3400 больных. Потом эта цифра постепенно растет, и с 2024 года уже идет на понижение. И, соответственно, финансирование было распределено изначально, исходя из изначального плана. Кроме того, государство выделяет средства и на охват превентивной терапии латентной туберкулезной инфекции. У нас ежегодно планируется охватить более 21 тысяч случаев с латентной туберкулезной инфекцией, и большая доля, это более 70% из средств государственного бюджета. Механизм закупок противотуберкулезных препаратов у нас идентичен с закупками гранта глобального фонда, то есть мы тоже пошли по этой стопе и осуществляем закупки через международную платформу GDF, которая оказывает техническую помощь в проведении этих расчетов, и посредством своей дистанционной помощи тоже со стороны своего регионального руководства. На 2020-2021 года в соответствии с постановлением были выделены около $4 миллионов на закуп противотуберкулезных препаратов. И в 2020 году, когда у нас был первый опыт государственной закупки, были определенные трудности именно не в самом процессе расчета потребностей или прокюрмента, а именно при завозе препаратов в стране. На таможенную очистку было выделено $60 тысяч, но мы столкнулись с такими трудностями, как в первую очередь это поступление финансовых средств, то есть эти денежные средства должны были поступить через Министерство здравоохранения на наш расчетный счет, а у нас имелся хозрасчетный счет и государственный счет, и в итоге, то есть эти средства, они изначально не были запланированы, но потом понадобилось время, чтобы перевести эти средства из счета Министерства финансов на наш текущий счет, что заняло тоже определенное количество времени. Еще у нас были трудности с ввозом в страну препаратов, так как они не были зарегистрированы на территории Республики Узбекистан, в связи с чем мы должны были платить дополнительно 15% НДС, а 15% от стоимости препаратов это была большая сумма, которую мы изначально не планировали в бюджете, но нам пошли навстречу и государство, и правительство, и Министерство здравоохранения. В первую очередь они дали нам добро хранить препараты у нас в собственном складе, то есть не на складе таможни, а именно у нас в центре, что сэкономило тоже определенное количество времени, денег для нас. Кроме того, нам разрешили завозить препараты путем получения одноразового разрешения на ввоз. Это сняла с нас НДС 15%, то есть этим мы не заплатили НДС. И все процедуры, связанные с проведением контроля качества, нам сделали за бесплатно. И в итоге мы смогли сэкономить от 60 тысяч еще плюс 20, из 60 тысяч 25 тысяч долларов США, что мы использовали в следующих наших поставках. И как наш заместитель министра уже отметил, в следующем постановлении президента мы на 4 года закладываем более 3,5 миллионов долларов ежегодно на закуп противотуберкулезных препаратов, как лечения для туберкулеза, так и для превентивной терапии. Кроме того, государство берет на себя обязанность закупать ежегодно 20 тысяч картриджей Genexpert Ultra. Кроме того, в 2019 году был начат процесс CRP, это ускоренный механизм регистрации препаратов в рамках реализации проекта USAID PKM+. Был разработан пакет документов, который дает производителю возможность в ускоренном порядке, это более месяца, если раньше на регистрацию требовалось от 6 месяцев до года, тут уже время сократилось до 1 месяца, и 40% снижает стоимость регистрации препарата. Условием данной процедуры является, что препарат должен иметь преквалификацию ВОЗ. И с помощью этой процедуры мы смогли зарегистрировать с ноября 2021 года 5 препаратов, которые закупаются из средств государственного бюджета. Я бы хотел остановиться на списке зарегистрированных препаратов, которые в настоящее время, из них 5 препаратов зарегистрированы с CRP, а остальные 2 были зарегистрированы стандартными методами. Но несмотря на то, что есть такой механизм CRP, очень трудно подталкивать производителей именно по отправке досье нашим регуляторным органам, в связи с чем мы доложили эту проблему руководству, и буквально пару недель назад, это 26 октября 2022 года, выходит новое постановление президента Республики Узбекистан, где прописывается, что препараты с преквалификацией ВОЗ не проходят при регистрации контроль качества. И кроме того, создается список на 3 года, который дает возможность завозить препараты, закупленных из средств государственного бюджета, без регистрации. То есть мы сейчас работаем над тем, что включить в этот список все свои препараты, и уже не понадобится никакая регистрация при ввозе в страну противотуберкулезных препаратов. Вот такие новости с Узбекистана. Спасибо за внимание.
Спасибо большое за впечатляющую презентацию. Пример очень сильного государственного лидерства и скоординированной работы команды профессионалов и правительства над достижением таких прекрасных результатов. Удачи вам. Спасибо огромное. Dear colleagues, we have honor to invite next speaker, head of WHO Collaboration Center from Latvia, Liga Kukša, with presentation examples of ensuring access to TB medicine and diagnostic in European Union. Welcome.
Dear colleagues, good afternoon for everyone. Dear facilitators of this session, dear colleagues, first of all, I would like to express my gratitude to the WHO Euro Regional Office for organizing such an amazing and fruitful meeting. And first of all, that is really a pleasure to meet you all, and I can face my eyes to any directions and see many good colleagues, and I'm really happy to see you all here. And I am invited to speak about example of ensuring access to TB medicines and diagnostics in EU. And first of all, in the beginning, a bit of history. And you see from the map, Latvia is very small, another Eastern Europe country. And if you look at the world map, that's even smaller. That's one small dot in a map. But we are from 2004, we are part of European Union and also part of member of NATO. And actually history, and many of you have heard let's say, success of Latvian TB program, and highest point of incidence was in 1998 with 70 per 100 population. And since then, we have a steady drop down of the cases, and now incidence is 12 on 100,000 population, and it's still almost half higher than in average in European region. So, and looking at the TB control, that usually we are asked about TB control program, but actually national TB program, but actually this activities of national TB program are included in all country strategy, national development plan, and also part of public health guidelines. And then activities for TB program are under those programs like strategic plan for HIV, viral hepatitis, STIs, and tuberculosis. And the second direction is planned combating antimicrobial resistance. So, and also if you look at the how the responsibilities are divided, then there is the structure of responsibilities and administrative level of TB controls in Latvia. And what I would like to say also and add to this, that all those responsibilities are well written in a law, and also description of each part of responsibilities are pretty clear, I would say. That was long way from the middle of 90s, almost till current time. And the same also is the procedures for organization and payment for healthcare services, including diagnostics and including TB medicines. And this regulation is, you see on the screen, that is cabinet regulation number 555. And all TB diagnostics and also the medicines are actually paid in two ways. One is cost per patient for treatment in the designated programs, and many of countries now are switching to the DRG system. That also we went that way, but TB program still is paid under those designated programs, not like DRG's diagnosis. And also the health services could be paid for based on invoice submitted by healthcare institutions. That's the two ways how it could be paid. And in this law and regulations also, there are specific points about the budget ups and downs, and how we are protected in this regard. And also that if something happened with funding, that TB and some other diagnoses are never touched, let's say so. So in about talking about the TB medications, and there the same approaches for diagnostics, that the all TB drugs we used and we have to be paid should be included in essential TB drug list. And you see that bedaquiline, the laminate, was included in 2015. That way was, let's say, pretty easy, but after that we had clofazimine experience. Actually, it wasn't easy way to include in essential TB drug list. And yesterday or day before yesterday, I talked about the rifampicin access, and Paul approached me regarding civil society involvement in this process. And I remember that actually patients help us to a bit quicker make the process of including clofazimine in essential TB medication list. And and the Ministry of Health and National Health Service approved this list and also confirmed budget for TB drugs and also TB diagnostics. And the main regulatory body is State Drug Agency for registration and distribution of the drugs. Procurement is provided through the country mechanism. That's very clear. And usually priority for drugs which are registered are for those who are registered in European Union. But of course, we have possibility to include an essential list like clofazimine, not registered in European Medical Agency. And that's my last slide. And I would like to say that nothing has been taken for granted, even peace in 21st of century. But looking at the TB program, the drugs are coming in, some of them are going out. The same is about diagnostics. We are happy that since very beginning of National TB program, we have very strong political commitment. We have very good, let's say, legal framework how to work program. But content always would be our professionals' responsibility. We know about the best practices, the best treatment regimens, best diagnostic needed, and we have to be ready to negotiate with Ministry of Health and National Health Service for including them. And of course, we would love to see a much easier mechanism for registering drugs, and we are discussing during the many days about this. And one more thing that sometimes we think that I am just league or just one person, I can't change something. But I strongly believe that all of us has a voice, and we can say and can put our efforts to the combat tuberculosis and probably end till the 2035. But also we can say about our attitude about the situation in Ukraine, and you know, the Latvia stand with Ukraine. Thank you very much.
Thank you, dear Liga. Thank you, Latvia, and all colleagues for strong support Ukraine. And especially thank you for fantastic example, our nearest future, because our region with a lot of diversity on the political issue, on the economical issue, and some conflict situation, unfortunately. But we have optimistic future together, because this day, this discussion, this speech clearly demonstrate that when we are together, we can move forward in any case. Thank you very much again. Thank you.
Dear colleagues, the next presentation on example on social protection to people affected by tuberculosis will be presented by the Deputy Director of the National TB Control Center of Tajikistan, Dr. Shahnoza Azam. Shahnoza, the floor is yours, please.
Добрый день, уважаемые коллеги, рада вас всех видеть, приветствую. Хочу предоставить короткую информацию об оказании социальной поддержки лицам, затронутым туберкулезом в Республике Таджикистан. Как вы знаете, если нет политической приверженности и поддержки со стороны правительства, реализация поставленных целей и задач является очень затруднительным. В данном слайде предоставляется информация о национальных директивных документов в течение периода 1998 года до сегодняшнего дня в стране подготовлено 4 национальные программы и 1 национальный стратегический план. На данный момент страна реализовывает национальную программу защиты населения от туберкулеза на период 2021-2025 года. В данной программе имеется одна задача, под второй задачей имеется предоставление услуг, ориентированных на нужды людей. Под четвертой задачей уже имеются конкретные пункты, где отражены следующие моменты. Обеспечение всестороннего ухода за больными всех форм туберкулеза, пациент-ориентированный подход. Что сюда входит? Обеспечить в рамках социального заказа заключение контракта с неправительственными организациями, которые будут получать финансирование со стороны государства. Следующее – обеспечение финансовой поддержки со стороны государства, а также мы знаем, что все время ставятся цели и задачи снижения катастрофических расходов со стороны пациентов или лиц, которые затронуты туберкулезом. В данном направлении у нас вот эта задача стоит. Кроме всего этого, в нашей национальной программе имеется предоставление продуктовой помощи, потому что продуктовая помощь является одной из частей лечения туберкулеза. Привлечение социальных работников для учреждения туберкулеза и первичного звена для оказания содействия в ведении пациентов с туберкулезом. Следующее – разработка стандартных услуг для общественных организаций в рамках контрактов социального заказа, которые они будут получать со стороны государства. Следующее идет использование цифровых технологий со стороны пациентов, а также медицинских сотрудников для приверженности лечения туберкулеза. И последнее – закупка электронных девайсов для усиления приверженности пациентов в стране. Как мы знаем, социальное сопровождение в рамках программы по ТБ – это помощь, предоставление поддержки приверженности путем систематического сопровождения лиц, затронутых туберкулезом, в целом поддержка прохождения полного курса лечения. А также социальная поддержка является процессом поддержки конкретного лица. Это то есть в каждой активности стоит человек, да, затронутым туберкулезом, к назначению противотуберкулезными препаратами, успешное лечение ТБ наиболее простым и эффективным путем использования всех имеющихся наших ресурсов, которые должны направиться для пациентов. Социальное сопровождение в Республике Таджикистан разделено на 3 части, можем сказать. Это психологическое консультирование ТБ-пациентов, создание психологических благоприятной среды, которая содействует пациенту, для содействия пациента, чтобы он дошел до конца лечения. Другое социальное сопровождение имеется в виду улучшение приверженности к лечению при предоставлении особых пакетов. И следующее – это адвокация путем содействия предоставления социальной помощи в виде продуктовых наборов для больных туберкулеза и юридической помощи, которая оказывается при необходимости лицам, затронутым туберкулезом, в виде оформления пенсии или других документов, которые, например, делается индивидуальный подход к каждому пациенту, который в этом нуждается. В данном слайде предоставляется информация о процессе предоставления услуг, о которых я выше уже указала, как бы это психологическая поддержка пациента, сопровождение пациентов во время диагностики и лечения, а также предоставление продуктовой помощи и также адвокационная помощь и юридическая помощь. Кроме адвокационной юридической помощи, также у нас практикуется предоставление пациентам некоторых средств, которые продолжат приносить им доход, чтобы они продолжили свое улучшение условий своей жизни, то есть делать дополнительные заработки, которые вы можете вот здесь наблюдать. Также в рамках социального сопровождения совместно с Министерством здравоохранения, Республиканским центром защиты населения туберкулеза и нашими партнерами проводится еще ряд мероприятий, которые направлены для социальной поддержки пациентам с туберкулезом. Вот ряд из них я вот здесь перечислила. Имеется в виду по итогам проведения адвокационных работ у нас есть некоторая договоренность о предоставлении финансовой оплаты со стороны местных мечетей в пилотных районах, также предоставление продуктовых наборов и материалов гигиены пациентам туберкулеза со стороны местных органов власти, а также практикуется привлечение предпринимателей для поддержки пациентов. То есть с ним ведется адвокационные работы, и каждый предприниматель может взять себе под опеку нескольких пациентов, которые они по потребам туберкулезных пациентов предоставляется помощь. Это может быть материальная помощь, это может быть продуктовая помощь или какая-то еще другая помощь, которую этот человек может оказать данному пациенту. Чаще всего среди предпринимателей, которые берут под опеку, это женщины с детьми или семьи, которые имеют низкий уровень дохода. А также, кроме всего этого, у нас практикуется совместно НТП, партнеры и проект «Остановить туберкулез», привлечение известных личностей, то есть это спортсмены, а также представители культурных, такие как артисты, да, например, спортсмены и религиозные деятели, которые проводят какие-то мероприятия, по итогам которых собирается определенная сумма, и эта сумма предоставляется туберкулезным центрам. В дальнейшем эти средства распределяются между теми пациентами, которые в этом нуждаются, как бы это тоже практикуется. Также, кроме социальной помощи, направленной, то есть материальной и финансовой, у нас есть поддержка по приверженности лечения, который на данный момент привлекается 31 район нашей страны. Это закупка мобильных телефонов для пациентов и ноутбуки и планшеты для врачей, которые будут контролировать лечение с помощью использования видеоконтролируемого лечения. Кроме партнеров государства, также имеется грант глобального фонда, который вносит свой значительный вклад в нашей стране. На данный момент в рамках гранта глобального фонда на период 2021-2023 год, который на данный момент реализовывается, также выделяется определенная сумма для предоставления социальной помощи пациентам лекарствоустойчивой формы туберкулеза. На сегодняшний день 842 пациентам предоставлено по 400 сомон каждый месяц, более чем на 1 миллион сомоней. Также НТП планирует внедрить единый подход по предоставлению социальной поддержки лицам, затронутым туберкулеза. Кроме глобального фонда, у нас также есть партнеры, как МСФ и USAID Этика, которые тоже практикуют предоставление социальной поддержки. МСФ практикует свою модель 3 пилотных районов, то есть у них идет предоставление продуктовой помощи, медикаменты, то есть патогенические препараты, а также гигиенические наборы для одного больного туберкулеза и 2 членам его семьи. Со стороны проекта USAID Этика 18 пилотных районов практикуется предоставление социальной помощи в виде продуктовых талонов. В данном слайде показан процесс предоставления тех услуг, о которых я выше указала вам. Это распределение мобильных телефонов пациентам, компьютеры, планшеты врачам и контейнеры для хранения пациентам лекарства у себя дома во время периода получения лечения. В данном слайде идет предоставлена информация о том, как проводятся адвокационные мероприятия. То есть вы можете наблюдать, что среди таких руководителей, например, комитет женщин, да, руководитель местного органа власти, а также представители культурных направлений, спортсмены и религиозные деятели, которые вносят свой вклад. И каждый год у нас меняются вот эти лица. Также сюда входят представители парламента, которые вносят свой значительный вклад в данном направлении. А также это активность, которая была реализована в рамках национальной программы. В связи с тем, что в национальной программе очень идет такой большой пункт по оказанию социальной помощи, она утверждена правительством. Со стороны НТП за последний год проведена адвокационная работа предоставления социальной помощи, чтобы она была устойчива. Что здесь подразумевается? Имеется в виду, что со стороны государства выделяется определенный бюджет, то есть туберкулезным диспансерам определяется определенный бюджет для предоставления социальной помощи на ежемесячной основе на весь период лечения пациентам туберкулеза. То есть данные средства получают, как, например, статью зарплаты или другие расходы. Также эта статья включена в расходы туберкулезной программы. На данный момент у нас вот в 7 городах и районах имеется такой опыт, и мы на этом не останавливаемся и планируем расширить данную практику в других городах и районах. Также хочу сказать, что впервые в 2022 году со стороны государства, то есть Министерства здравоохранения и социальной защиты населения Республики Таджикистан, был выделен первый грант для неправительственной организации, который будет предоставлять услуги для ТБ-пациентов. Следующие шаги, то, что мы планируем, это внедрение единого подхода для предоставления социальной помощи лицам, затронутым туберкулезом в стране, проведение адвокационных мероприятий местными органами, то, что я сказала, то, что включить государственный бюджет, предоставление социальной помощи, а также увеличение финансирования для поддержки неправительственной организации в стране, чтобы их количество неправительственной организации и финансовые средства, которые выделяются данному неправительственному сектору, чтобы увеличилось и чтобы они могли более качественно и больше предоставлять услуги туберкулезным пациентам. Спасибо большое.
Thank you so much, Dr. Shahnoza, for very thorough presentation, especially we were really impressed with this multi-level engagement of leaders of influence in the communities, like religious leaders and business, the example of businessmen who supported particular patient in the particular districts. And of course, in the midset of the pandemic, we know that the government made it possible to give an award to NGO Avesta for 2 years. It's a really great success, so congratulations.
Thank you, Tajikistan, for fantastic presentation. And we have honor to invite for next presentation, Yana Terleva, NTP manager from Ukraine, with presentation about success story and example of MAF implementation in Ukraine. Welcome, Yana.
Добрый день, уважаемые участники. Позвольте представить презентацию от имени секретариата Национального совета, который, к сожалению, сегодня в связи с отсутствием доступа к свету и связи не смог представить эту презентацию, поэтому для меня большая честь рассказать об нашей совместной работе в отношении внедрения механизма межсекторального взаимодействия. На сегодняшний день Украина, как и все страны, приняла ряд политических обязательств на выполнение межсекторального взаимодействия, и часть из этих обязательств уже на сегодняшний день успешно выполняются. В частности, разработана и принята государственная стратегия противодействия туберкулезу, ВИЧ и гепатитам до 2030 года. И на выполнение данной стратегии будет разработан трехлетний комплексный план, проект которого разработан, и, соответственно, внесены изменения с учетом представления регионального комплексного плана Всемирной организации здравоохранения. Также есть государственная стратегия развития противотуберкулезной службы и комплексный план на выполнение данной стратегии. Оба эти документа также являются межсекторальными, поскольку к исполнителям в том числе вовлекаются разные министерства и ведомства. Если посмотреть на структуру наших организаций, которые вовлечены в программу противодействия туберкулеза, как мы видим, ряд министерств и ведомств занимают важное значение, а также мы привлекаем неправительственный сектор, понимая, насколько важно гражданское сообщество, в более полном понимании о том, с какими проблемами сталкиваются люди на пути к излечению от туберкулеза. Если сгруппировать, то основные барьеры, мы о них говорили, информация о них получена путем проведения нескольких комплексных исследований по инструментам Всемирной организации здравоохранения, а также партнерства Stop-TB. И очевидно, что для устранения каждого этого барьера потребуется привлечение не только Министерства здравоохранения, но и практически всех министерств и ведомств. Таким образом, для того, чтобы усиливать координацию на разных уровнях, в стране существует 3 площадки, которые в том числе являются координирующим. Одна из площадок – парламентская платформа, вторая – это Национальный совет противодействия туберкулезу и ВИЧ, и у нас есть украинская площадка партнерства «Остановить туберкулез». В настоящее время Национальный совет является одним из важных игроков, в том числе по межсекторальному взаимодействию. Наш Национальный совет довольно-таки активен, он собирается на регулярной основе, и даже сейчас, несмотря на все сложности, буквально в прошлом месяце заседал Национальный совет, и также работают подкомитеты довольно-таки активно. Возглавляет Национальный совет министр, и у него есть 2 заместителя. Один заместитель – это министр социальной защиты, и второй заместитель представляет людей, переболевших, людей, которые сталкиваются с ВИЧ. Также, если посмотреть по статуту Национального совета, то во многом в функционале данной площадки является приоритизация пробелов, которые существуют, также координация не только государственного, но и донорского финансирования с привлечением на наиболее важные аспекты для страны. В том числе Национальный совет проводит мониторинг программ, участвует в разработке нормативно-правовых актов и, что важно, так как одним из элементов является подотчетность, Национальный совет подотчетен Кабинету министров и в том числе информирует о выполненной работе по направлению туберкулеза. Также перед нами всеми стоит очень важная задача по обеспечению устойчивости наших программ, и также Национальный совет координирует выполнение государственной стратегии, о которой я уже поминала, и в том числе имеет ряд эффективных инструментов, которые позволяют привлекать к ответственности для исполнения тех активностей, которые урегулированы на законодательном уровне. Таким образом, мы использовали фактически для укрепления межсекторального взаимодействия хорошо налаженную существующую площадку в стране Национальный совет. И, собственно, это решение было принято и поддержано еще 28 января в 2021 году, где все партнеры поддержали такое решение. И, собственно, одним из первых шагов, который был выполнен практически 1,5 года назад, была проведена исходная базовая оценка, насколько все министерства и ведомства вовлечены, насколько они понимают свою роль в программах противодействия туберкулеза. Есть результаты этой оценки, можно с ними ознакомиться, но самый важный вывод – это то, что ни одно министерство и ведомство не сообщила о том, что оно не готово вовлекаться в программу противодействия туберкулезу. То есть каждый сказал, что да, мы не против. И второй вывод, один из самых важных, был сделан о том, что но мы не знаем как. И, собственно говоря, эти выводы легли в основу следующей нашей инициативы – это разработка дорожной карты. Сегодня Сахат говорила, что всего несколько стран разработали эту дорожную карту. Она действительно помогает вот понять вот эту роль каждого министерства, что конкретно они могут сделать, какое конкретное мероприятие, с каким бюджетом и в какие сроки. Конечно же, это очень помогает программам противодействия туберкулеза. Также механизмы, которые существуют в наших странах, это слушания профильных комитетов Верховных Советов, и в частности вопросы, связанные с межсекторальным взаимодействием, также представляются на данных площадках. И, собственно говоря, были также рекомендации о поддержке и разработке дорожной карты, в том числе на этом уровне. Следующим шагом для уже реализации принятых решений стало проведение второго национального диалога, который был проведен при участии практически всех министерств и ведомств, парламентариев, международных, национальных партнеров, а также гражданского сообщества, на котором были представлены элементы и наработки по дорожной карте. И, собственно говоря, принята резолюция второго национального диалога, в которой закреплены все наши договоренности. Таким образом, следующим шагом мы ожидаем, что будет финализация данной дорожной карты, и, по сути, каждое министерство должно будет пересмотреть свои планы, свои политики и включить конкретно в свою деятельность мероприятия из дорожной карты. А каждый год будет проводиться отчетность каждым министерством и ведомством, кабинету министров, который оценит, насколько эта деятельность была успешна. Таким образом, мы идем по такому пути и верим, что он может быть полезен в том числе для ваших стран, потому что действительно на сегодняшний день туберкулез может быть искоренен только путем консолидации усилий абсолютно всех участников. Спасибо за внимание.
Спасибо, Яна. Пример Украины говорит о том, что межсекторальное, межведомственное партнерство является очень серьезным инструментом устойчивости программ, несмотря на вызовы. Мы абсолютно уверены, что несмотря на беспрецедентный вызов для Украины, такое партнерство, безусловно, поможет нам удержать стратегию в преодолении туберкулеза в нашей стране, и мы с удовольствием поделимся с коллегами. Спасибо, Яна. Дорогие друзья, я буду говорить на русском языке, поскольку у нас сейчас должна быть раздельное заседание в группах по странам. Мы посоветовались с секретариатом и пришли к выводу, что мы можем немножко изменить формат, уже привычный за эти 3 дня, и предоставить вам возможность в течение 10, максимум 15 минут ознакомиться со второй закладкой в ваших компьютерах, которая касается согласования национальных стратегических документов. Презентацию этого компонента сделала уважаемая Стелла в начале. Обратите, пожалуйста, внимание на основные интервенции, предложенные региональным стратегическим планом. Люди в центре предоставления услуг, стратегическое управление, лидерство, финансирование, кадровые ресурсы, стратегическая информация и доступ к продукции. Вы просмотрите эти документы на основании тех обсуждений, которые вы уже провели у себя в страновых командах в предыдущие 2 дня. Мы предложим вам через 10-15 минут использовать тот же инструмент слайда, для того, чтобы ответить конкретно на вопросы, которые мы подготовили для вас по каждому из этих направлений. Нам кажется, что это будет динамично, более, скажем так, интерактивно и поможет нам объективно оценить уже сейчас в аудитории понимание и пробелы, которые у нас есть в этом направлении. Итак, время пошло. В вашем распоряжении до 15 минут, пожалуйста. И я прошу, глубокоуважаемый секретариат, ровно через 15 минут подготовить нам слайды для ответов. Благодарю вас. Пожалуйста, приступайте к работе. QR-код, либо набрать slido.com, и вы увидите сейчас на экране вопросы по основным разделам того компонента, который мы только что с вами посмотрели в ваших рабочих планах. Пожалуйста. Андрей, мы готовы? Не, ну это... да.
Вы можете выбрать несколько вариантов. Скорее всего, может быть, у вас даже есть несколько проблем.
Андрей, мы будем работать в русскоязычной и англоязычной версии или только англоязычной?
Там переведено, все идет английский, после английского идет русский.
Окей, спасибо большое. Дорогие коллеги, отвечаем.
Пока что только 18 участников у нас. Еще раз напоминаю, что вы можете это просканировать через QR-код либо там на экране, либо с вашего бэджа. — 26 участников. — 30. Больше будет.
Мгм. Уважаемые коллеги, 2 минуты, пожалуйста. Нас не меньше 40 человек в страновых командах. Пожалуйста, подключитесь. Кто еще не подключился, буквально 1 минута, Андрей, и мы переходим к следующему блоку вопросов, пожалуйста. 34. Переходим к следующему блоку. Раздел по финансированию. Пожалуйста, будьте внимательны. Как сказал Андрей, вы можете выбрать не один, вы можете выбрать несколько вопросов, если вы считаете их актуальными, проблемными для вашей страны, необходимыми для последующего развития. Больше половины ответов уже есть. Пожалуйста, коллеги, 1 минута.
Да, давайте дадим еще, потому что список длинный.
Да. Я могу вернуться. Так, то есть первый блок вопросов ты можешь мне вернуть потом, да? Ну, не сейчас. Пусть они все, да, да, с ответами. Все блоки, да. Мгм. Всё. Следующий блок вопросов, пожалуйста. Это легкий фрагмент, уважаемые коллеги. Есть ли у вас механизмы по избежанию дублирования технической помощи? Отлично. Следующий блок вопросов, пожалуйста. Для каких ключевых приоритетов в кадровой обеспеченности системы здравоохранения, включая на уровне сообществ, вам необходима техническая поддержка? Также тут могут быть больше, чем один ответ. Пожалуйста, коллеги. Андрей, мы закончили ответы на этот вопрос. У нас следующий блок есть. Также очень короткий блок. Является ли электронная база данных по туберкулезу источником эпидданных, представляемых вами на национальном и международном уровне? Андрей, мы завершили. Пожалуйста, для того, чтобы подвести короткий итог, еще шестой, пожалуйста, шестой вопрос. Какова роль первичной медико-санитарной помощи в области борьбы с туберкулезом в вашей стране? 4 вопроса, коллеги. Пожалуйста, выбирайте. Следующий, пожалуйста, Андрей. Следующий вопрос. Скажите, сможете ли вы заключать контракты на предоставление услуг по борьбе с туберкулезом на уровне сообществ последующие 2 года? Если да, то когда?
Есть механизм для социальных контрактов.
Следующий вопрос, пожалуйста, Андрей. Какой уровень использования цифровых технологий, обеспечения приверженности, включая лечение с видеоподдержкой, является достижимым для вас к 2025 году? Следующий вопрос, Андрей. Есть ли в вашей стране мониторинг, осуществляемый сообществом? Следующий вопрос, Андрей. Это был последний? Отлично. Мы можем подвести итоги, правильно? Угу. Ясно. Коллеги, отвечаем на последний вопрос по закупкам. Да, да. Есть. Спасибо, коллеги. Опрос завершен. Коротко итоги. Прошу вас. Андрей, верните нам первый, пожалуйста.
Thank you, dear colleagues. So the results are for the question for the gaps of under the governance leadership. The 71% answered that adaptation of multi-sectoral accountability framework would be the response to this, which is good. The rest of the question received like 50 is less than 50%. So I would like to highlight this one also. Next one. Thank you. The second question. The gaps and challenges on the health financing, universal health access. So the responses that public funding or supportive TB services through social contracting. It was the most popular one. So 70% of countries are ready to provide this. And I think the less we receive the answer on ensure financial access of services to all people, especially vulnerable groups and key populations, which is 1/3 of responses. But I think it's a critical one. So next question. So do you have mechanism in place to avoiding duplication of technical assistance? Most of the answered, most of the people, 83%, they confirmed that they have this mechanism in country, and only 2% mentioned that they don't have. But 15% though do not know. Do you have mechanism? And number 4, for which key priorities on the health workforce, including community health workers, you need technical support? The most popular one, provide adequate regulation, capacity building, and support for community-based members of the health workforce. And the rest of the questions, answers are around 50%, and the last one, merge the TB specialty with the pulmonology infection disease specialty, which is also, I think, a really important one, but we got the less answers on this one. For which key priorities is the EPI data you report at national level and to international partners expected from UTB electronic data system? So yes is 79%, no is 9%, and partially is 12%. So we still have room. Yeah, so we still should. Definitely. And next one, what is the role of primary health care in TB care in your country? 63% answered limited to screening and directly observed treatment, and 5% key coordinator of TB care across the cascade of care. So, and 1/3 responded do not have a clear role, but planning to make it stronger, which is kind of good tendency, but still, since primary health care is considered as a kind of hub for the provision of patient-centered approach. And the next one, please. Will you be able to contact community-based TB services in the next 2 years? 58% answered yes, TB supportive services, and no is 19%. The next one. What is available target of use digital adherence technologies, including video-supported DOT by 2025? More than 50% responded 66%, and 40 to 59, 21%, 9%, 30 to 39, and less than 30% is 4%, which is, I think, good. And the next one. Do you have community-led monitoring in the country? Yes, 16%, no, 32%, do not know, 2%. I think it's more rooms to work on this. And the last one, and not least one, of course, are you ready to take over fully the procurement of all TB commodities from national budget by 2025? Partially 47%. Yes, for all commodities, including new drugs, 21%. And no, 14%. Yes, for all treatment regimens, same 14%. And yes, for all diagnostic commodities, actually 0. So that was the
Yeah, thank you, Dilerom. Thank you. DeAndre, we will be very happy if you will have possibility to share a result of this questionnaire with our participants, because it's really very, very good issue for thoughts and for discussion on the country level about possible gaps, especially in context of sustainability, some programmatic context, including procurement, for example. Dear colleagues, thank you very much for your active participation. We have just now 15 minutes for coffee break, and we wait you back in 15 minutes in 4:25. Have a nice coffee.
For this session, we would like to invite to the stage to join us Askar Yildibayev from WHO Euro, Monica Diaz from WHO headquarters, Luchika Dutishi will join us online, and Viral Sultan, Stop TB Partnership. Also, Mrs. Katarzyna Drażek-Lakowska, the head of international development of Ministry of Health of Poland, and Dr. Sabirov, Deputy Minister of Health of Uzbekistan. Please welcome to the stage. We are waiting for you to start the section. Yes, Nino Berzili from WHO Euro, please also join our team since we will complete our session with the closing, with the summary and closing remarks. Thank you.
Dear colleagues, thank you very much. We have honor to invite for presentation our colleague and friend Askar Yildibayev from WHO Euro with presentation Bringing Action Together, Results of Mapping of NSP. Welcome. Askar.
Thank you very much, dear Chair. And I would like to, at the very beginning, thank my colleague, Dr. Mikhail Volek, for supporting me in preparation of the summary of this exercise that we've been using and going through the past 4 days. So I would like briefly touch base that we have the regional ambitious milestones and targets The milestones by 2025, we have to take in mind, and this is like what this meeting was about. We have been discussing all technical areas from how to do to achieve this ambitious milestone, setting up the trajectory towards 2030. And again, I would like to repeat that one of the major objective of this meeting is to support the member states, you, dear colleagues, with operational planning for this next 3 years, 2023, 2024, and 2025 through this discussion and develop this operational planning on what will be done. So I'm really glad to acknowledge that all the discussions that happened during the breakout sessions have been very instrumental. You have been vocal, you have been clearly articulating the needs, and that is actually bringing us to the homework for us of what we as WHO partner organizations, the donor organizations will do to support you during the next 3 years. We also hope that the exercise that we have been discussing will be helping you in your proposals to the next funding cycle of the Global Fund allocation that is covering the period of 2024 and 2025. So again, I would like to repeat that by ensuring the alignment of the national strategic plans or documents with the regional action plan, this will help us also to increase the commitment from your governments to support you with implementation. It is important to notice that the national strategic planning is a live process. It's a dynamic process. Yes, the 5-year period is maybe like a bit long, but again, the 3-year operational planning is more dynamic. It's bring more, I would say, strength to the document and will support you with implementation of your national tuberculosis responses. And the way what we include into the NSPs, how we amend the NSPs, or how we consider in our actions in the national strategic plans will result in how we set up the trajectory. Because if we achieve the targets by 2025 that are listed here on the left upper corner of the slide, this will definitely bring us faster to the targets that were set up by 2030, and which we will achieve much faster. So these are the summary of the discussions. So the first pillar, first day, we started with discussion with the people at the center, and here are the highlights only on the challenges that a majority of countries identified. The first challenge is to continue to reduce unnecessary hospitalization, admissions, and stays with the clinical criteria. We have to focus on this, and majority of countries indicated that as a challenge. So the other challenge is that there is a slow uptake of implementing the WHO standardized package of community-based services to improve treatment outcomes. So this is very much important. And also to consider all elements that are available in these important documents that was developed by the regional project TB-REP before. So another is very important, and it was a topic of discussion to address the community rights and gender issues. And this majority of countries highlighted. If we speak about the area 1B, comprehensive tuberculosis prevention, yet all countries identified that they are on the way and a good progress has been done. First is by getting the consolidated approach of combining the guidelines on prevention and screening and making it more targeted, revising the paradigm, focusing on population at higher risk of developing tuberculosis and vulnerable population groups. So nevertheless, the countries highlighted that there is a support and scale up by TPT by applying multi-sectoral accountability approach is needed. So it is really important to identify the role and engage meaningfully civil society to this specific technical area. So this is high in the agenda and we should definitely focus on this. So review and update the NSPs based on the assessment of the TB prevention cascade of care was another challenge, and the technical support for all of us will be there. So, and implement the tuberculosis infection control surveillance and response monitoring system at the country level. When we speak about the area 1C, systematic screening for tuberculosis, So there was a challenge identified by countries in which support is needed on creating the demand for tuberculosis screening and prevention among key population. Still, not enough efforts has been done in this area. And ensure the sustainable and domestic funding for systematic screening of tuberculosis disease. There are several examples available already in the region on the ensuring systematic screening for tuberculosis, also including NGOs, also including civil society. So please do so, involve your other partners to this technical area. And provide key populations with maximum package of TB and HIV detection and services in place. So these two technical areas, 1B and 1C, will contribute significantly to reaching out those targets that were missed during the 2018-2022 commitments by the UNHLM 2018. On tuberculosis diagnosis, we should continue applying the people-centered approach and diagnosis services, expanding access close to the point of care, integrated mobile multi-disease testing. So all the efforts and the technical support needed to be done on that. So countries identified. However, without undermining other priority actions that listed in the TB Regional Action Plan, these are the key challenges highlighted. On treatment and care, the good progress in all the countries, it's really good to acknowledge that planning to uptake the latest guidelines on treatment of TB drug-susceptible children and adolescents, and also on scaling up access to the bedaquiline, predominant, and linezolid BPAL regimens for treatment of MDR and pre-XDR tuberculosis. However, the challenges were on ensuring the provision of psychosocial support, including through the civil society organizations and communities. This is really glad to hear. And ensure the provision of palliative care of services for people affected by tuberculosis, and also providing support to people affected by TB suffering from mental health and substance use disorders. This is another area for all of us to focus on. On the pillar 3, the new interventions, and intensified research and innovation. Again, the focus was need to be done on developing the national TB research plans with budget estimations and resource mapping. So which means that an allocation of additional resources, both from the national budgets and from the donor funding, is needed to boost the uptake of the latest benefits of the research and introduce innovations. Also, there is a support needed by countries on establishing the TB research units at the national level. And we have highlighted all the priority actions in this specific technical area. And capacity building, training on tuberculosis research, postgraduate education of TB researchers, and international exchanges. Again, there were several examples shared during this meeting and available in the region on how the advanced training on tuberculosis research, of how it apply into practice, is available. And this is a homework for us to consider. And I would like to finish this presentation with this quote: "Nothing is more expensive than a missed opportunity," by Jackson Brown Jr., American author. But at the same time, I started my presentation at the very beginning on day 1 with this quote and finishing it with that. So let's not miss this opportunity. Thank you.
Thank you, Oscar, for very comprehensive summary of our 3 days work. It's very inspiring for all of us, especially in context our clear understanding that this meeting, it's very important steps on the road preparing for the new high-level meeting in TB in 2023. And we have a big honor to start now close remark for the main partners and main actors who play critical role globally and regionally for end TB till 2030. And we have big honor to invite for summary speech our colleague from headquarter WHO office in Geneva, Monica Diaz. Please, Monica.
Thank you. Thank you very much, dear Chair. So I'm speaking on behalf of my director, Dr. Teresa Kasaeva, The focus of these remarks is on preparations for the UN high-level meeting, and I'd like to just showcase a few slides to remind everyone about next steps, priorities for action looking ahead. So if I could ask for the final set of slides to please come up, that would be great. So I will be fairly quick as the slides come up. First, to remind you that, and you've heard this already from several presentations, that the 2018 UN high-level meeting on TB was path-breaking for the TB community. For the first time, we had heads of state come together from all of your countries as well, to commit to end TB. We had strong commitments and critical actions. So if we can move to the next slide. So just to remind everyone, the political declaration of the UN high-level meeting, there's been a request for the next in 2023 to have a comprehensive review by heads of state. And if you go to the next slide, you'll see also in 2020, we had UN Secretary General progress report on TB that was released with, and we spoke about this during our session with Deputy Ministers of Health. There were 10 priority recommendations. Again, reminding you, there's been this request to WHO to work with partners and the UN. Thank you very much. And member states to prepare for this high-level meeting, which is what I think has been a core part of our discussions here today. So looking ahead to this 2023 UN high-level meeting on TB, this region is going to be critical. So the President of the General Assembly, who really manages this meeting and the preparations, is from the region. It's His Excellency, Mr. Saba Korosi, President of the UN General Assembly. You can see again from this region. We have here at the same table the co-facilitators from Uzbekistan and Poland, and it's been really great to take this opportunity of this meeting to meet and map out, next steps of preparations, because the co-facilitators will play a big role, again, from the European region. So this is really, I think, critical, and it's good to share the stage here with colleagues from Uzbekistan and Poland. And of course, to remind that we have what we expect is going to be another political declaration, and we want it to be as meaningful as the one that we had in 2018. And so all of your engagement, given that this declaration will be negotiated by member states, will be critical. All of you already shared several key asks. We did a lot of Slidos, we had a lot of presentations. You shared key asks, key priorities from your countries, from your perspective, ranging from people-centered care, civil society engagement, to TB prevention, to the core technical areas, to financing. All of these need to be reflected, and with targets, we can make sure that there is implementation. So very quickly, our director, Dr. Kasaiva, already shared this roadmap. We have come quite a long way. We're at the end of 2022. But looking ahead, we have a resolution on the scope and modalities that's being developed in New York by the co-facilitators, by Uzbekistan and Poland, led by the missions in New York. This will give us a sense of the format of the meeting, which will then help us prepare looking ahead. We plan to hold a UN mission briefing like we've done in the past with partners, of course. In terms of high-level review, we will lead the process of having a global review of progress, which will be similar to the UN Secretary General Progress Report. There is civil society hearing, there's a World Health Assembly, which is also a major touch point. We have a strategic advisory group meeting, and of course, we hope in September we will have the next high-level meeting. a major point, a major milestone as we look at the roadmap ahead is going to be the interactive civil society hearing, or as they call it, multi-stakeholder hearings, which will bring together, the key asks from civil society, from communities. And again, we have partners in the room, we have civil society groups, and like last time, we hope that together we can come up with the communities will come up with these strong key asks that can drive the process for the declaration and make sure that we have strong commitments. Also, looking ahead at the political declaration, just to flag that at WHO with partners again, we will be moving ahead with a second DG flagship initiative in 2018. The flagship initiative had the targets of the 40 million and 30 million. These were reflected in the political declaration then. So we hope that this new updated flagship initiative with our Director General's new term will also be instrumental in being featured in the new declaration. So we have concrete targets in the declaration. Another aspect in terms of preparation, this is to very quickly show you the level of preparation, the level of participation. In 2018, we had over 1,000 participants. We had 15 heads of state, over 100 ministers and country delegations, and over 360 civil society and other stakeholders. Now, this is going to be important. We had 15 heads of state. Then we need to make sure that heads of state from the countries represented in the room participate actively. Also, given that, as you've heard already, there's going to be not just one, there are going to be 3 UN high-level meetings, one on UHC, one on pandemic preparedness and response. We want to ensure that all 3 high-level meetings, which are focused on health, have maximum head of state participation. So it's important to really, as you do preparations, looking ahead to September, that you also start speaking higher up to encourage participation. The other aspect is the high-level review. As I showed you in the initial slide, one of the commitments is that heads of state in 2023 will have to make statements of progress or present a high-level review of progress. That means your head of state will have to take the floor at the UN high-level meeting on TB in 2023. So this is something we need to work towards, to plan towards. I already mentioned that at the global level, we will be doing a high-level review similar to the UNST progress report. At the national level, this will be something for countries to already begin planning. What are the key opportunities that can be leveraged where you can get head of state participation from other sectors? This could be joint monitoring mission, high-level debriefing. It could be World TB Day. Or other high-level opportunities in your country between now and September when the next high-level meeting takes place. And it should be looking at all the commitments and mapping the status of progress, which all of you have been doing already as we've discussed, but this would have to then be presented by the head of state. So I'd just like to flag, as I'm ending, a couple of things. WHO has a collaborative multi-stakeholder, multi-sectoral platform with partners, also with the engagement of our civil society task force in this. So we will be definitely engaged with the regional office, with country offices, to take forward preparations, and we are here to fully support you. We're also here, similar to 2018, to support in terms of advocacy. This high-level meeting will require a lot of global advocacy, and here are a few examples from press conferences, media stakeouts. We did several side events. We documented health minister voices. All of this is the drumbeat leading to the next UN high-level meeting to make sure that ending TB is high on the agenda. Also using social media. At the country level, also there is need for high-level political dialogue, and this was one of the priorities that in the previous session you highlighted as one of the top 2. So political dialogue will be important to prepare for the high-level meeting. And here are a few examples of campaigns that we have done since 2018. This could again be, this needs to be a priority as well. And of course, support for advocacy at national level. We will be sharing a full package of communications materials, country profiles, data, a letter from our Director General, all the things that we did in 2018 to again make sure that, the high-level meeting gets that prioritization that it requires. So in summary, basically, we need all hands on deck for the high-level reviews of progress, for strategic dialogue and advocacy, also for making sure that there is multi-sectoral engagement and accountability, and to contribute to the political declaration as well as to encourage head of state participation. So thank you very much.
Thank you very much, Monica, for your presentation. And dear colleagues, please welcome our next speaker, the Executive Director of Stop TB Partnership, Dr. Luchika Ditu. She will be joining us through video call.
Yeah.
Please, Luchika.
Hi, hello. Sorry for being a bit in a shadow, but maybe we all should stay a bit in a shadow these days. Okay, so thank you very much for making it work and happen. And hello from Geneva for the second time today. I want to thank again all of you for spending this entire week there. I was able to hear the summary from Askar. I was able to hear the speakers, and it looks that it was a very great week for the European region. Now, we speak for the ways forward here, and thank you for this session and for really coming all together ahead. I am very happy that you all had the chance to really discuss with leadership from Uzbekistan and Poland, maybe as Hungary as well, in there, as we all discuss with the missions in New York, looking forward for the UNHLM 2023. I know you discussed that. I just want to say that 2018 was indeed, as also I heard Monica saying, an important moment for us in TB. We had a great declaration and great commitment. Following on the same a bit cynical pattern as I started in the morning, so what? So what? We had the leaders committing on a lot of things, okay? We were very happy, as Monica said. I was one of those celebrating together with Teresa and all of you in September 2018, because we had a strong political declaration, very good numbers, a DG flagship initiative, great commitment from the heads of states. And we are not reaching except one target, which is not even fully on our hands. That's all is reached from that declaration, okay? At the end of December, it's the end of the 5 years period. So it was good we had the political declaration. We did a lot of advocacy with it, and we started in a good way. COVID pushed us back, but let's admit that even before COVID is not that we had, and I speak here at global level, a lot of attention and a lot of resources for TB, okay? And we still have millions of people without access to the main tools that we have. So now going for 2023 UN high-level meeting. As Monica said, this region took the flowers because both PGA and the cost facilitators are from this region. So I am afraid that the pressure on Askar, Stella, Nino, and Hans as a team will be very high, because you co-facilitate a meeting, you need to show the way in many ways. You need to have some good examples to give to showcase the leadership. So it will be very important that the work that is happening now in the region will be very much highlighted for this. As Stop TB Partnership, our board led by the Minister of Health of India, we have 7 other ministers of health there from all high burden countries. The representative from the region is Her Excellency, the Minister of Health of Kazakhstan. We will as well working all together, pushing forward this UNHLM agenda. As you already heard, we hope that having a WHO DG initiative will help in pushing forward some agendas, and that, as last time it was WHO, Stop TB, and Global Fund as a group having this flagship initiative. We hope to continue in the same way. We had some discussions already this week, but more important, 3 things for you, and I'm really happy that we have a chance to address all of you here. We need to pressure that the UN high-level meeting on TB is taking place in September as a month next year and more specifically on 20 or 22nd September. This is something that the PGA decides with discussions with the two co-facilitators. So the UN ambassadors in the two countries will have an important say. However, a very important say will have other countries in New York, because usually there is some dialogue that they have around these dates. So any entry points with your own country's embassies in New York will be extremely useful. So that's a very important piece for all of us. It's a must to have this in September 2023, not in other months. For you to know, I co-signed a letter with the UHC leadership for the UNHLM on universal health coverage that was sent to the PGA through different channels. I think we received it 3-4 times, asking that considering there is a UHC meeting and the TB meeting, that they are together in consecutive days. And that is really good that we had this agreement with the UHC. The second point is, as you heard, but is very important to underline, is we will need to have missions in New York briefings. We have the resources to do not just the briefings, but to bring some relevant people from the countries when this is happening. There are several countries that are keen to co-host, ideally with the two co-facilitators, these UN missions briefings in New York. They should be as well in Geneva. So we are obviously looking forward to work with WHO and all the other colleagues, and especially the country leadership, to ensure that these briefings are really good. What is this briefing? Is basically bringing together people that usually have so much on their agenda that TB is not that relevant for them, and they need to understand what's such a big deal about TB and why we need the UNHLM, why we need a strong political declaration, so on and so on and so on. From the Stop TB side as well, you need to know two things more, and I will end. One is that civil society engagement is very important, and communities. As strong, as important, you know, as the engagement of the governments. It cannot go one without the other. So we are making sure that we fund an organization that will work with civil society and communities group to ensure that they are properly engaged, aware, and coordinated for the UNHLM. And obviously as well, we are a strong partner into securing a broad engagement throughout the process of the civil society and communities, but also their participation in this civil society hearing. What is a civil society hearing? Is a meeting in New York in which basically representatives from civil society communities, but other non-state actors are coming together. So you can have private sector, researchers, you can have as well universities representatives to discuss about the TB matters. And that discussion can be then further included into the political declaration. So that will be an important moment that hopefully should be sometimes in April, May, not later, considering all the things. Monica and WHO, and I heard all of you speaking about multi-sectorial accountability framework. And I think it's very important, and I think that will go ahead and very good. We are supporting a report coming out from people that is called the Deadly Divide version 2. This report basically looks at the deadly divide between the promises and what is happening, between the North and the South, between the rich people and the poor people in the country, and will represent, how to say, the view of those that we are actually all trying to help, people affected by TB, being them from the big North or the big South, it doesn't matter. And we know very well, and I saw Paul speaking before there, you know, UK, you would say a high-income country, blah, 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 but we know very well there are a lot of people with TB there. And the people with TB in UK, as in many other countries, are actually not having access to the tools that they are expecting to have, and not easy also to get diagnosed and treated. So it will be a report that will actually should not look just at one part of the world or another. It should look in general at TB. The last point, so we will deploy some of these resources in this aspect. And we are together with our colleagues from WHO convening conversations with our partners. And we just had one yesterday, and we will continue to have every 2-3 weeks It's a platform for everyone to come in, not only to listen, but also to engage and contribute, because there will be a lot to happen, not only in developing a political declaration that has very strong targets, but in securing that we have high-level engagement and participation in the countries, that we have comprehensive delegations coming to New York, but more important than that, that we have a genuine embracing of the TB situation and of the TB commitments by the country's leadership. We are in the year 2022, almost in the year 2023. I feel very bitter and very sad because COVID pushed us back a lot. Many people in the room there, we know each other for a life. I think I saw Natalia, I think it was Natalia Nizova, hi Natalia, speaking before. You know, we know each other for so long. Some of us spent entire career in working in TB. We are not the most popular people, neither at global, neither at regional, neither at country level. The pulmonologists, the physiatrists are not the sexiest, are not the ones being in front of the donors or so on. But we have a very good mandate in helping people with TB. We have a chance in 2023 with this UNHLM to make the case again for some strong commitments. But for that, we need two things. We need to work together and leave aside separate agendas and intentions and me, I'm smarter or beautiful or whatever connected than the other. Starting with us in Stop TB and all organizations, we need to work shoulder to shoulder for that. I know very well the WHO offices and region and global and national, we are all on the same boat, but that's for all the partners. And the second is we need to be ambitious, and we need the amazing countries of Poland, Uzbekistan, and Hungary from this region to lead the way and to remain in history for a strong UNHLM meeting in 2023 to give hope for those coming after us that we will have a world without TB, because we can do it. We just don't have the enough support, but 2023 is the opportunity to give us the support. So thank you so much. Sorry, I took a lot of time. I hope you enjoy a bit of Istanbul. Geneva is a bit boring as always, but thank you. Take care of you.
Thank you, dear Luchika, for you, as always, a very inspiring speech and fantastic window of opportunity for new thinking on the stage, our common preparing for the high-level meeting. It's really very important that our region will present as co-facilitator to fantastic country with fantastic move forward in TB area, Poland and Uzbekistan. And we have honor just now to kindly ask to provide some thoughts and speech about how we can move forward in preparing for high-level meeting as a regional team for our honorable guest, Katarzyna Jacek-Laskowska, sorry for my pronunciation, head of International of Health Department, Ministry of Health of Poland.
Thank you very much, honorable participants, dear chairs, dear colleagues. First of all, let me congratulate you and ourselves on participating on this very, very fruitful meeting. As my colleagues said before, we are facing a great challenge for our region. The high-level meeting next year on the tuberculosis on the United Nations community. It is a great pleasure to cooperate with Uzbekistan. It is a very challenging way, and I hope that we will cooperate together with colleagues from Uzbekistan, but also in our region. It is a great pleasure for us as a Polish government also. Still, we're facing the issue that TB and drug-resistant TB are the main risks, the main hazards for the public health health safety in the European region of WHO. Of course, as a region, we achieved big development in the decreasing of new cases of TB, and also about the mortality depending on this disease. Of course, we are facing new goals, new challenges on the reduction of TB and co-infection with HIV and TB. We know that it is a cause of mortality in our region, and we should solve these problems. We know that COVID-19 pandemic create a new reality, new normality for us, and it has a big touch in our developments in the WHO region on achieving goals regarding the TB. We know that since the 2020, information about new cases of TB were very decreasing because people were not registered the infections. We know that TB and multi-rifampicin resistant TB are also very important in our region, and we need to be prepared to solve these issues. We also are aware that war crisis in Ukraine escalate the humanitarian crisis in Europe, and it might have very important touch on our development of regional goals related to TB. We know about new opportunities to prevent TB, to diagnose this disease, to treat this disease, and to provide necessary health care to be prepared on reactions on our governments and healthcare system to create the best solutions for patients. Still, we are in the deep touch by COVID-19, but I hope that we will also face these challenges successfully. On the 72 Regional Committee session, member states agreed the action plan for the WHO region on TB on the 2023 till 2030. We are strongly supporting the actions undertaken by the regions to decrease new cases of TB. New action plan on TB on WHO region, WHO Euro region creates priorities to member states regarding to TB fighting. We strongly sign the need to be back on the good way to realize and TB strategic in our region. Our action plan shows us a general vision, but also a strategic activities that must be undertaken to eliminate TB in WHO Euro region. Our documents creates also a milestone which are necessary to achieve this very responsible goal and to fulfill our obligations on the level of United Nations level. We are here today to initiate realization actions against TB in our member states. I know that this is a very long and challenging way, but I also strongly believe that together, in a strong cooperation in our region, we will successfully reach our goals. Thank you very much.
Thank you very much, Ms. Katarzyna, for your insight on this matter. Dear colleagues, I would like to introduce our next honorable speaker, the Deputy Minister of Health of Uzbekistan, Professor Sabirov Ulugбек Yusupkhanovich. Please.
Уважаемые коллеги, добрый вечер еще раз. И я бы хотел сказать, что вот моя коллега из Польши, она сказала много чего. Это большая честь, то, что две страны именно из европейской части, то есть Евровоз, были отобраны как фасилитаторы. Это большая честь и большая ответственность. И мы сегодня переговорили с польской делегацией, мы переговорили с WHO, то есть с офисом ВОЗ. То есть мы построили шаги, как мы будем делать, как мы будем работать, в каких направлениях будем идти. Я думаю, мы предоставим документ, согласованный с вами со всеми, и этот документ будет отражать все почти аспекты для того, чтобы мы смогли победить эту инфекцию. Уважаемые коллеги, спасибо вам.
Воистину краткость сестра таланта. Спасибо большое. Дорогие друзья, we are on the final line of our meeting, and we have honor to kindly ask Nina Berdzuli from WHO Euro Office to provide summary of our meeting generally and provide like close speech for our 4 days conversation, which mean not finish, but only start new stage of our way to high-level meeting. Welcome, Nina.
Thank you so much, Chair. And I guess I will not do the speech because you've heard enough. I think over the past 4 days, it's been a long working week, I would say. But I think it was a very great and a fantastic meeting. First time after 3-4 years coming together and having this great opportunity to do the knowledge exchange, sharing of the knowledge, sharing of the critical capacities and the achievements and the challenges that we are still facing in terms of the ending the TB. So I've heard a lot of very interesting ideas and definitely the inspiration that comes from you, from our countries, from our partners, and I hope that you also are very energized and inspired by this meeting. And going home, now you will be taking all those actions that we agreed during this 4 days meeting back to your home countries and truly accelerate the action in order to be able to show really the way forward, as Luchika said, because we have a big agenda in front of us during the next year to truly demonstrate the Euro region, the pan-European region that is true leader and the champion in the fight against TB. I'm particularly thankful to governments of Poland and Uzbekistan for their commitment and the readiness to co-host the UN high-level meeting TB in 2023. It is really great honor, as has been said, for Euro to have 2 member states, 2 countries from the European region that will be co-facilitating, co-hosting this high-level event. It gives big visibility to the European region and a big political visibility also from the European region to the TB agenda. Please count on our support in preparations for this high-level meeting. I thank you, all of you, for very inspiring and enthusiastic discussions. I'm encouraged by your personal commitment, encouraged by the commitments that were made during our ministerial panel, and thank to the deputy ministers that participated in this panel today for very clear commitments to take the concrete steps and the concrete actions in their own countries to work towards the TB targets. I wish you all a very safe journey to home, to your countries, and look forward to seeing you very soon. I would like to thank our partners, to all that colleagues that participated in this fantastic meeting. And I would also like to thank the regional office, WHO Europe regional office colleagues. And I would like to ask the team, my team from the regional office, to stand up and big applaud to you, Askar, Stella, and everybody. You know, can you please? Yeah, can you please stand? All the admin colleagues, yes. Thank you so much. Thank you so much for your support and for organizing such a fantastic meeting, and of course to our admin colleagues who were at the backstage in organizing this meeting. Again, big thank you to all of you, and safe journey home, and see you soon.
Dear colleagues, we would like to invite everybody, including, of course, the organizers, the event, the WHO Euro colleagues who not only participated, but also helped us with logistics, with everything. We really appreciate it. We would like to invite everybody to a joint photo, because for recent days we had different one, but we really want to have one share with everybody. Please.
Hello. Dear colleagues, members of TAC-TB, would it be possible for TAC-TB members to stay in the room for 15-20 minutes if, after the group photo? Thank you very much.